Okay, let's try now. Can everybody online hear me?
Yes,
Yes,
thank
we
you.
can hear you.
Okay, I think everybody can hear me. Okay, sorry about that. So whether you're here with us in the room or you're joining from across Oregon, we're just really glad that you're here to join us today. Before we begin, we want to know who's joining us. So if you're online, we would love for you to drop your organization and your location in the chat. If you're in the room, you've already been doing some talking, but feel free to just say hello to someone next to you. I know we've got partners joining from around the state, and we really thank you for driving all this way to come see us. It's really a privilege to be here with you. We're excited to welcome more partners this year than really ever before. Excuse me. Thank you for the time you spend helping people understand the health coverage options and for the relationships that you build and the trust that you've earned with the communities you serve. And thank you for the care, expertise, and commitment that you bring to your work. Your partnership really is essential. And the work of connecting people to coverage is a shared effort. We are grateful for the role that you play in making that possible. So today is an opportunity for us to come together. We're going to reconnect. We're going to recognize the important work that's happening across our partner network. We're excited to have you here, and we appreciate the opportunity again to spend time together. And with that, I am pleased to welcome our director, Chicky Flowers, who will share more about the vision for Oregon State-Based Marketplace and the work ahead. So thank you again for being here, and welcome to the summit.
Amy is much taller than I am. Good morning, everyone, and welcome to the 2026 Partner Summit, the Marketplace Partner Summit. My name is Chicky Flowers. My pronouns are she, her, hers, and shakanya, and I am the director of the Oregon Health Insurance Marketplace. It's such a privilege to be here with all of you, our agents and our assistants, the people who are on the front lines every day helping people in Oregon find health coverage that fits their needs. Before we talk about what's ahead, I want to start with something pretty simple. Thank you. Thank you for the conversations you have with people when they're navigating complicated decisions. Thank you for the trust you build with communities across Oregon. Thank you for answering questions, solving problems, and helping people take an important step toward protecting their health and their financial security. The work you do matters. As we come together this year, we are doing so at a moment of significant change, a moment that brings new opportunities, new tools, and understandably, some uncertainty. We're also entering a period of transition within the Oregon Health Authority. As you may or may not have seen in the news, as our agency undergoes changes in our director's office in the months ahead, I'm reminded that what makes this work successful isn't any one person. It's a shared commitment of everyone across OHA and all our partners. That commitment to serving the people of Oregon, improving access to coverage, and working together will continue, and I know we're well positioned for what comes next. This summit is not just about updates. It is about connection. It is about making sure we are aligned, prepared, and moving forward together. Because the future of health coverage in Oregon depends on all of us. Over the next few hours, you'll hear more about our work underway, the changes coming, and the resources available to support you. Today, I want to know where we're going, why we're making these changes, and why I'm so optimistic about what we can accomplish together. This year marks the beginning of a new era and a new chapter for Oregon's marketplace. We are very, very proud and very, very excited to introduce you to Explore Health. Explore Health is our new state-based marketplace platform. It represents more than a new name or a new look. It represents our vision for the next era of Oregon health insurance marketplace. So what's our vision? A marketplace that's easier to understand. A marketplace that is more connected to the people we serve. A marketplace that reflects Oregon. Innovative, community-focused, and committed to making health coverage accessible for everyone who needs it. And while we have Explore Health, and while we will have Explore Health, rather, please note that OregonHealthcare.gov is not going away. It will remain an important destination for people in Oregon who are seeking information about health coverage. It will remain a trusted resource. Explore Health is the evolution of our marketplace identity, a way for us to be who we are and what we offer as we move forward. A strong brand is more than a logo or a website. It is about creating an experience. It's about helping people know where to turn and feeling confident when they get there. And you, our enrollment partners, are a critical part of that experience. Because no matter how much technology improves, no matter how many resources we create, people still need people. They need somebody who can answer their questions. They need somebody who understands their situation. They need somebody who can guide them through decisions that may feel overwhelming. You all get to be that somebody or somebodies for a friend, a neighbor, a fellow Oregonian, and we can't get all enough for taking on that role. If I haven't said this enough, this transition is a big step forward for our state. It gives us greater ability to design systems and experiences around the needs of Oregon's diverse communities. It allows us to continue improving how consumers access coverage and how our partners support them. And importantly, it strengthens our ability to respond to what comes next. We know the health coverage landscape is changing. We know that there are federal changes ahead that will impact all of us the next few years, including changes affecting qualified health plans and Oregon health plan programs connected to the marketplace. We also know that whenever change happens, people have concerns. They want needs for themselves, their families, and their communities. And that is exactly why your role is so important. During times of change, people look for trusted guidance. They look for someone who can help separate uncertainty from action, someone who can help them understand their options and make informed decisions. You are that trusted guide. And our commitment to you is that we will make sure you have the information, tools, and support you need to continue doing that work.
I apologize. I need to switch your microphone real quick. We're having a little bit of technical difficulties.
Okay. Testing. Hello? Okay.
Volume up in just a second.
Do I have to start my speech all over again? I might need some water. That we'll have to start over, but just waiting for a green light. Good to go? Okay. All right, I will not start over, but hopefully in conclusion, well, a little bit more, one more page. We may not control every change happening around us, but we do control how we prepare, how we communicate, and how we show up for the people who depend on us. And I believe Oregon is incredibly well positioned because of the partnerships represented at this summit. When I think about the marketplace, I don't just think about systems or programs. I think about people. I think about the Oregon families who can see a doctor because they found coverage. Oh, thank you. I think about people. I think about Oregon families who can see a doctor because they found coverage. I think about the small business owners who have options because someone helped them understand what was available. I think about the communities that are stronger because people have access to care. That impact happens because of the work you do and the work we do with you. So as we launch Explore Health, as we move into a new phase as a state-based marketplace, and as we navigate federal and state changes ahead, I want you to know this. You are not just partners in this work. You're a part of the future we are building. We are so grateful for your expertise. We are grateful for your commitments, and we are grateful for the trust you have placed in us as we take these next steps together. There's a lot ahead of us, and today is just the beginning. You'll hear more throughout the summit about the details, the timeline, and the ways we will support you through this transition. But I hope you leave today with one message. Oregon's marketplace is evolving, and we are moving forward with purpose. We are building a stronger, more accessible experience for the people of Oregon. We are embracing innovation while staying grounded in our mission, and we are doing it together. Thank you for everything you do. Thank you for being here, for making the trek for wherever you came from, and thank you for being such an important part of Oregon's
This is
health
so
coverage
nice.
story.
Right?
And with that,
Let me mute it. Hold on.
again, thank you, welcome, and enjoy the day. And again, y'all, thank you very much.
Thank you so much for sharing that vision, Chickie, and for setting the stage for where we're headed together. I next want to welcome Miranda, Katie, and Victor to the stage for the next section. As we continue today, we're gonna move from the broader vision for Oregon's marketplace into a closer look at how our state-based marketplace will function. And before I forget, I'm gonna actually move the slides forward. There we go. And how it will support the work we do with consumers and partners. This next session will provide an overview of some features, our customer assistance pathways, and communications as we move forward. We'll pause here for a moment. If you're joining virtually, please feel free to drop questions in the chat, and we'll be capturing those throughout the session and making sure we address key things.
I think you have 2 copies of PowerPoint open because the slide isn't progressing here or on Teams.
There we go. Okay.
Thank you.
Just an FYI, chat's not working for me, maybe not other
Okay.
people, so.
Sure. I'm gonna hand it over to you.
Morning, everyone. I'm Victor Garcia. I'm Operations Advisor and Program Liaison for the Marketplace, and I'm just going to present hopefully some slides that'll let you know what to expect and what you're going to see as we begin training and then begin actual live interaction with the system. Starting with the customer journey. We usually point people towards the Find Local Help tool, and from there, they can either start looking at options for like their own shopping, or they would contact based on somebody they found in that help tool. And from there, they will kind of move through the Explore Health application process, again, kind of with assistance or on their own. And then based on the outcome of that application, they would either be redirected to the one system if they're eligible for like Medicaid or other programs, OHP programs, and then if not, they'll proceed through the rest of the application that you're all familiar with. So looking at their tax credits, potential cost sharing reductions, qualified health plans, et cetera, or do that same sort of thing kind of on the one side of things where that's all handled for them. So the start to finish experience, we hope folks will go and kind of go through the guided sort of plan selection, starting their account, completing their application, enrolling in that health plan, and optionally enrolling in a dental plan, and then that binder payment kind of effectuates the plan in the happy path. So from there, your role and how that will work in the system. We do have sort of a single landing page, so there will be one sign-on for everyone, or one sign-on page rather for everyone, and your credentials will get you into the appropriate portal. So when we use the term portal, it's not that you're going to different websites necessarily, it's just where you're landing. So as an agent, where you land and the options you have will look different than our assisters. The foundation of those two portals is very similar. So there's a lot of shared tasks that are in that system, but overall, again, sort of scope of practice differences are captured in these portals, and the types of things you're able to do kind of depend on your relative role. So for our enrollment partners, both agents and assisters, you'll have the option to manage book of business. So that's anybody you've been authorized to work on behalf of in the marketplace, assisting consumers with their application enrollment. And that includes being able to sort of be in the system, taking the role of the consumer. Once you've been authorized by that consumer, you're able to kind of fill out the application on their behalf. So that includes sort of uploading of documents, and then managing customer assignments. So if there's an agency or an assister organization with multiple people kind of under its umbrella, you'll be able to manage who's assisting which clients at that level. Reviewing customer notices, so any notices that your customers are getting, and then uploading any associated documents on their behalf if they need that kind of help. So lots of things.
Sorry, everyone, just 1 second.
Testing. While they're doing that, I just want everyone to know we will be taking questions at the end.
Should I present in Teams? Okay. Okay, so I will do both. So this is, okay, back to where I was. In both of these portals, the consumers or customers that you help will have to request the assignments of either an agent or an assistor to help them. And then once that request is done, when they've found someone through our Find Local Help tool, then they can send that request, and then on your side, you'll accept that request if you're requesting that person's assignment of you. This is something you can kind of help guide the customers through, but because of how we've established our relationship with Get Insured, the provider of the system, and that we do things a little different than most other states, as most other states do things a little different from each other. As we go on, the way exactly this works may change, or depending on your feedback and input, but for now, this is kind of the one that we're sure kind of meets the standards for ensuring the best prevention of sort of the fraud, waste, and abuse that CMS has been focused on. So it starts with the customers requesting, and then the partners accepting those assignments. And I should add here, this is sort of going to be the ongoing, like how it works sort of after open enrollment and during open enrollment. Leading up to that, we will have a data migration. And so that data migration will include any sort of agents of record for those customers that will be pulled over with that data migration information. So this won't need to be done necessarily for everybody coming over in that data migration for this year. But going forward, any new customers would go through this process. And then as far as actually assisting the customers through the portal, again, as I mentioned, once you're assigned, you're able to view the customer's information. You can sort of assume their role, sort of you can sort of switch your view as though you were the consumer, and then can fill that out on their behalf. And again, be able to sort of view any relevant information, upload documents as needed. In terms of There are several different ways to request assistance. If there's anything that needs addressing, either as part of a consumer's account or some kind of issue that you're having with either the system or some information kind of not lining up as you would expect. So we always have, the call-in ability, but there's also a ticketing system built in so that if you have either one or multiple kind of things you wanted to ask about, you can submit a ticket through that system and keep track of it. So you'll be able to see that on your dashboard, see the progress of that ticket and who it's associated with. Again, always have the option to contact us directly via phone or other means, but this is a good way to submit these things without necessarily needing to call in. Sorry, just. There we go. So for community partners, and this is where we're kind of split off about some of the differences between the two portals. For community partners, as well as for agents, and they have a sort of counterpart, the organizations will kind of manage their own local help finder listings. So we have our local help finder tool. It will be a little different because it will be part of this system, and the information that's in there, like name, address, that sort of thing. A few things are locked in, but there are some things that can be changed about that information. This is just to be able to make sure that you can keep your most current information up to date. If there's a office either location added or changed, that can be done through the various menus for managing these local help finder listings. And we do want to make it as easy as possible for folks to continue to find you with whatever specialties you have, that sort of thing. In terms of sort of a hierarchy of things that can be done in these portals, we have several different roles available depending on the size of the organizations, be they assisters or agents. So for assisters, there are things that can be done at the organization level, and there'll be managers that are assigned for each organization. So each organization will have sort of a lead person or manager that can sort of change various things in the portal, like who is assigned to which assisters. So moving customers from one assister to another, having a list of assisters that are part of the organization, certification status of those assisters, and renewal dates, things to keep track of, like the training and a few other options. And then that changes a little bit with each role. And it's just, again, sort of make the administration part of these things a little easier. Especially when you're dealing with an organization where there may be multiple people helping multiple clients that may switch back and forth. So adding new assisters, that includes that. Organization managers can request to add new assisters. That request gets sent in. Obviously, it depends on certification status. So that'll be something that happens with like a double check on our side of things. But this would add like another assister to the list of assisters in that organization. And this is, once that's been done, and once we've added some assisters, we've had the information updated in the Find Local Help tool, you can then view that in the Local Help Finder. Organizations are listed at the organization level, but within that you can see the individual assisters that are part of that organization. And then people looking for local help or that are already looking for an organization that they already know the name of and that they want to specifically look for, they can then click on those individual assisters to see more information about the services that are offered. And again, this is something that we've been working on with Get Insured. So to the extent that we're able to kind of tailor this to feedback and how this is working for people, we can try and kind of fine tune that as we go. But our priority was obviously getting this working for open enrollment, and then seeing what might need to change after that. And then in a similar way, the insurance agency can manage their own finder listings. Again, that's sort of new addresses, office locations, that kind of information. And anything that isn't able to be changed here can be requested through our team, but we try to make this have as many self-service options as possible so that there's not a constant need to have us do everything for you in terms of those updates. And then again, in a similar way as to Assisters, there's sort of an agency manager role. For independent agents, you would essentially be your own manager. But for agencies, there would be sort of a managing agent that could then kind of administer the various agents and books of business within that for marketplace, or I'm sorry, Explore Health plans. So agency managers can see all of the agents in the agency, and in a similar way, number of clients, license number, certification status, and really any other kind of pertinent information that's relevant to those agents that are part of that agency. And then as far as adding new agents, again, similar process as to with the Assisters, where that request is submitted, and we'll just verify, certification status, that sort of thing, and then have that agent added. And then from there on forward, any, clients that are assigned to other agents can then be reassigned to the agent that's now part of the agency, or, new clients that come in with that agent can be redistributed to others as needed, according to how that agency works. And then again, in a similar way, viewing agents in the local help finder. Once that's done, added some agents, have had the information updated in the portal for the local help finder information. That information can be searched by individual agent. And I don't know that there can be like an agency search, and that is one of the things we're working on with Get Insured, but definitely insurance agents generally are found at the individual level. So if there's a specific agent that is being searched for, again, you can kind of help guide the customer through this, especially if they're setting up their account and trying to assign an agent, helping them find you, and then make that request so that you can make sure that they're attached to you. This is, again, where they would kind of find that connection with you and then select from there to add the agent to their authorization to their account. And as far as managing the book of business, a few different options in these dashboards and portals, in that it will also include sort of a listing, I think, that includes like a premiums, that sort of thing. We are still working on a lot of that with Get Insured, but in general, it will be kind of, as mentioned before, being able to assume the role of the customer that you have, and being able to get in and upload documents if that's needed, or being able to address any tickets, trouble tickets, that kind of thing. And then also being able to move depending on the role. Again, the agency managers can kind of move applicants back and forth between different agents within the agency. When an agent leaves the agency manager can bulk transfer. So, the entire sort of list can be transferred to another person, or, in chunks that way. So trying to make that easier generally to manage at the agency level if you get multiple agents under your umbrella. And I think this is just a little bit of a deeper dive into the bulk transfer mechanism. Just a few clicks in that sort of managing agent section, you can transfer the customer delegations and move them again to other agents if someone's leaving the agency. And in the same way, if somebody's coming in and you decided you want this person to have these customers, or these customers from different folks, you can also move them in the same way. And once that's done, or once that's been performed a few times, you can also see the delegation history of any set of customers, or the set of customers for the agency. There's different ways to search, so you'll be able to search by by agent, or kind of whole book of business for the agency. But that information will be available to see who's been transferred, how many times to whom. And that just kind of may help with making sure there's not too much turnover moving of different customers to different agents too many times in a row. Just again, tools to kind of help make the management of those plans a little easier, or those customers a little easier. And then for managing the assister book of business, that pretty much works the same way. So within an assister organization, those customers can be transferred back and forth between different assisters as needed, or if an assister is leaving or coming in and wanting to bulk transfer those clients or customers to a different assister. Again, try to make that easy as possible to do that in bulk and just move people over in chunks or all at once if you're handing off from one person to the other. So obviously you'll see a lot more of these in the trainings that will be coming up, but we did want to be able to give a preview of what to expect and the sorts of functions that you'll be able to do once you're in there, and to sort of see what they look like as well. And as always, we're accepting feedback as we go, and any changes that we're able to affect or anything that feel could work a little better, we're always open to hearing more information about that. I think. Okay. And then jumping off just a little bit from that, there is nightly batch application processing. So once the applications are done for customers, if they, for example, been referred to Medicaid or from Medicaid, it's a automated process that happens once every evening. And this kind of prevents some of the hiccups we've seen where if there's multiple changes that happen during one day to a customer record, sometimes that can negatively impact whether that's carriers or the one system. And so by kind of consolidating to that nightly batch application processing, we hope to cut down on those hiccups that might happen again with the other side of things, having to constantly update new information if multiple changes happen in one day. This applies the business rules to process the incoming records and making sure the outgoing records are going out appropriately, and provide status tracking, error handling, reconciliation to make sure that we know who's been successfully submitted and what kind of exceptions there may have been or what kind of errors. And then we're able to support a lot more applications at one time because only the freshest or newest version of that application is actually going out in that nightly batch transfer. So if multiple things happen during the day, again, that's sort of narrowed to just what was the last kind of customer record status or the application status. And then eligibility notices will be sent during that nightly batch processing. So instead of receiving a notice every time anything happens to a customer's record, again, whatever that last status is before that nightly batch is performed, that's the notice that the customer would receive. And that just kind of helps prevent confusion, multiple messaging from the same interaction, basically, if just a few things were changed or a few things were tweaked. Again, that sort of one time per day helps cut down on that confusion. And then, again, only the last application processed that day in a similar fashion would be referred to the one system if there's potential OHP eligibility. And to the extent that that is sort of in process, be able to kind of see that status from the customer record section of your respective portals. So I think that covers the, yeah. Okay, and I guess we're going to stop there for questions.
We do have a few from the chat. Let's start with the room, Don, and then we'll move to the chat because people were raising their hands earlier. Hi, I'm Ms. Urias. I'm the deputy director. I'll walk around and grab whoever has questions. I mean, whoever's the first contestant. Oh, wait, we're not. We're not winning anything today, just saying. All right, Sid.
So if we go back to like slide 7, I believe it was, can a client or community member do their own if we have done it through the assister portal? So once we do it through the assister portal, they will also have their own that they can manage?
That's correct. Yeah, the customer can always interact with their own
And then the
account and
other part of
application.
that, when we're doing that, do we have to, like, when we're sitting down with a community member, because I'm an assistant, I go through my portal, do they also then have to set up theirs at the same time in that appointment?
At least to begin with, yes. So the customer will need to set up their own account and select you or your organization as their authorized delegation or their sort of authorized consent form. And then once that's done, you'll be able to see that customer on your side of things in your portal, and you'll be able to do everything else on their behalf.
So when you're sitting down with an appointment, that would simultaneously happen, like we would, how does that look? Does that mean like they sit down and we have them set up theirs and then we go in and set up ours? Like, I guess that's what I'm not understanding, because in the past, when we did healthcare.gov, we would go in, do an application, they set up theirs, and then when it says, are you getting assistance, and they add us, and then it's basically theirs. Like, we didn't have our own portal.
Sure, and that would be an option. So if the customer or you wanted to sort of walk through their portal experience, they could go in and have their own application. But regardless of how that application gets in there, there will, if you want to be working on their behalf, they will need to go through that sort of selection process to like add you as an authorized user or delegation to their account. But then how that actually happens really does depend on how you would prefer to do it. So in some cases, customer may already have an account, great. If they don't already, then yes, they would need to set up something. It would have to start with them, regardless of how that happens. So if you wanted to walk through their portal in an application in their portal, could also do that. You can be added at any time. You don't have to be added before the application part. So if they've already gone through even the enrollment, they can still select an organization or individual to be their authorized representative that way through the portal. So so there's no. Oh, go ahead.
Testing? Oh, I just had to get closer. I just got done doing mini UAT, so user testing in the sandbox is what we call it, I think. And it's actually very intuitive. So I went in, logged in as a community partner. I was able to set up everything. The consumer does need to then log in and change their password, but after they use the email that you set up for them and they change their password and log in, everything connects. So the application you did, everything will be there waiting for them once they claim their household. So you can create it, do the application and everything for them, but then they would need to go to like the login page and go through the process of creating their password to claim their account.
So it's somewhat like the market, to just help them get that initial application
Yes.
in their, okay.
But you're not needing to do the setup. Sorry, you're not needing to do the setup of the account like you're a customer. You're able to do it through your assister portal. So it's a different step. It's a different process. Yeah. It's hard to explain it until you see it, but you'll see it in training.
Okay.
Yes.
So from that point forward, basically, every next time the customer has an interaction with you, they won't need to log into anything. Once you're authorized as their representative, you'll be able to do everything on their behalf through your own portal. They won't need to remember their.
And then my last two questions. I actually have a lot. On slide 4, you were showing that the different like OHP and then marketplace or a new score. Will the new one look at the score? Will it look at the monthly income or the yearly income? Because one of our barriers with healthcare.gov is when you put in their income, it says, what is your income for 2027? And so then people put that in, and then it says you're eligible for OHP, which then that goes to the slides you were just going over. And this method, if we're not getting eligibility notices till that night, so we get will we also as agents or sisters get eligibility notices so that we know what to help our community members with? So that means we may have to have another appointment with them to follow up.
That depends on a lot of variables. So just to start with your first question, the eligibility logic is now specific to Oregon. So is it annual or is it monthly actually sort of depends on what the customers move through so far in the process. So depending on that logic, if they get to a point where it looks like, oh, there's indicators here that there may be eligibility markers for Medicaid, BHP, OHP, whatever the case might be, then the logic will shift to asking the appropriate questions to make those assessments. So we're not determining eligibility for the one system, but we're trying to get as darn close as possible and closer than healthcare.gov. So, it will kind of narrow down to the questions that make the most sense based on the information that's already been provided. So we've been working with Get Insured to make sure that logic now includes kind of knowing actually what BHP is and not just thinking that BHP is OHP with more income, but that there are different markers for that, and that's all incorporated into that logic. So you should see that happen more smoothly with more accuracy. And then in terms of the eligibility notices, that will also depend in some cases if there is kind of a not instant response from the one system in terms of, checking for that assessment. If we think that the person might be eligible, sending that over there, having them evaluate like from their system perspective. If that doesn't come back right away or needs a little extra time and is pending, then that will need to wait either for that nightly batch if they're done by then, or however long that takes on that side of things. Otherwise, there is potentially an instant response that you'll see. So if there is a check that's done in real time or near real time with the one system, that will come back and you'll be able to see it. So you won't necessarily need to wait for the nightly notice, but in terms of the official notices that go out for eligibility that a customer would receive as a document, that would wait for the nightly batch. So in many instances, you'd be able to see in real time, yes or no. And in the cases where it's going to take more time for that decision to happen, then that more time would be necessary to wait.
So basically you're saying that will help us alleviate the dual eligibility where someone went in, they put in their income and they go, wait, and then they fix it and we enroll them. Once we've enrolled them in a health plan, they shouldn't also then end up in OHP. Is that how I'm seeing this movement? Boy, do I love that. I do not want to do 199 appeals. My last part of that is on slide 5, you said that pay the binder payment. Will they actually be able to pay their payment this year versus in healthcare.gov? That never worked.
Sure. We are working with carriers to have a pay now link that will go directly to the carriers to make that binder payment. As much as we would love to kind of incorporate that as just inherent to the system where you can just pay, through the Explore Health portal. We have seen in other states where that didn't go so great right off the bat. So it may be something we explore later, but in the interest of making sure we don't add anything that isn't absolutely necessary to make sure that the system is working correctly for enrollment, we'd much prefer to be able to connect those people directly with the carriers to make those payments for now. It is, a little less convenient to have the two windows open, but again, with all of the extra layers that are needed to be added within the system to kind of take those payments on the carrier's behalf, there's a lot more potential for errors to happen that way. So for now, making sure that people are directed in real time, like once they've gotten that the process is done, the enrollment is done, here's the link to pay now, and they can go directly to that site to make that payment. So yes, not integrated into the system, but definitely directed to do that at the end of the enrollment.
Okay, in the chat, we do have questions about if out-of-state agents will be listed on the Find Help tool.
Okay, so prior to answering or asking your questions, answering everybody, sorry, again, this is Jenny Flowers. For those in the virtual room, presenters, as you hear the question, please repeat it, and please also speak into the mic. So we are having some technical issues connecting the room with the physical room, connecting it to the virtual room. So if you can all help us make these accommodations for our virtual attendees, we would be most grateful. So thank you.
So I'm sorry, what was that last question, Dawn? Will out-of-state agents be on the
Michael
Find
Wallace,
Local Help tool?
Will Collian.
Yes.
So the question having already been read, I won't revisit that, but at least for the time being, yes, out-of-state agents would still be listed, of course, in there with their address being out-of-state. Not as likely going to be as requested for assistance as those folks that are located in the state. Hope that helps answer the question.
All right, moving back to the room, over to Glenn.
One of the issues I've had doing mid-year changes is people who go through job changes, the questions on income are hard to do because some will have 4 months of job income from an employer, and then they go on unemployment, or they start unemployment 9 months into the year. And are questions going to allow us to get a little more focus on some of those uneven types of income that people have when we're doing applications?
So if I'm understanding your question, basically you're asking if the questions are going to be a little bit more intuitive as far as helping people answer the income questions. So they're a little bit more
I
accurate.
don't know, it's intuitive, but so like one of the problems I have, say someone leaves a job, 4 months into the year, they made $20,000. Well, I can put that in as job income, but it's really only for 4 months. So then I end up putting in one time only, which doesn't really help with the OHP calculation. Unemployment's another one. You know, it's a 6-month award that can bridge years. Those are some of the limitations of the healthcare.gov application around that puts some gray into income calculating with people.
Yes, so the question is asked around income calculation and putting income in for partial year. And we did a lot of work, extensive work on the application to try and make it as easy as possible to understand what you're putting in. But there are specific questions on the income section that ask about the dates of employment. So if you're not, it'll ask if it's for the whole year, and if you say no, it'll ask you specifically what dates.
That's the improvement.
I'll move to the chat. Can you clarify who are managers and their organizations, arms agents, considered individual agents? The verbiage is confusing.
Sure. So the question was, sorry to repeat, you've all heard it, but just making sure the folks online can hear it too, what is the role of the agency manager? What about agents that are independent or don't have an agency? The role of agency manager is to be able to manage agents underneath the umbrella of an agency and manage the books of business within, but also for independent agents, essentially, again, your role would be that of an agency manager. It's just you're an agency of one. So you'd have all the same abilities that an agency manager would have as an individual agent. You just don't have anybody else that you're managing as an agent. So, the idea is to make it easier for the administration of an agency. And there are also going to be roles for admin staff as well that can only do certain things. And we'll be going through a lot of that in the training. But again, the idea is to make it easier to manage agencies generally, and then those same abilities or same permissions would be, obviously, an independent agent would have all of them for themselves as an agency manager, again, as an agency owner.
And there is an associated question, can there be more than one agency manager?
So the question is, can there be more than one agency manager? Yes, as far as I know, there isn't anything limiting that. It's just a matter of making sure that permissions are granted properly. Once an agency manager is assigned, they may be able to either request another agency manager or assign that themselves. We're still kind of working through how that authority works. And again, we'll be presenting that in the training, so we'll have that definitive answer then.
Back to the room.
Okay, so this is kind of a recap, I guess. So kind of going back to some of the OHP and the nightly batch. When we are in working with a client, putting them in there, will the system also flag if they have OHP already? So maybe they don't know they have it, they were signed up at a clinic. I run into that several times as an agent. They have OHP, have no idea, and then we run into tax problems at the end of the year. So will it also flag it if it sees an OHP application or potential match?
So the question was, will the system flag it if there is a potential match in OHP for someone that already has coverage but maybe hasn't mentioned that? And it's just kind of enrolling for an Explore Health application for coverage. The short answer is yes, but so there are circumstances in which that may not happen because of the way people are matched between the Explore Health system and the One system, that as long as they provided information that does match up on the one side of things, that eligibility kind of ping is done, and that includes checking for MEC, minimum essential coverage, so not just OHP, but also BHP and any other kind of one-run programs that may fall into that EHB bucket. So that, or the MEC bucket. So those things are performed, again, sort of in more or less real time. And unless there is some kind of need for further eligibility to be determined on the one side of things, if they do have an existing account and that information matches up, you should see that right away, that they would essentially be deemed like not eligible for marketplace coverage.
Yeah, that actually answered the second question I had already. So perfect. Thank you.
Robert. All right, back to the chat. Will there be a sandbox for us to practice with before going live?
So the question is, will there be a sandbox to practice in before going live? I don't have all the information on that, but if...
Sorry, it takes a second to turn on. So there won't be a sandbox per se, but we will have a soft launch. So agents will be able to get into the system probably aiming for early October, and still TBD on assisters. We're still kind of working that out. So you'll be able to at least get in and get familiar with the system. And your clients should be connected to you if you have completed the form that I sent to you. If you haven't completed that form, please see me and I will send it to you.
And I should add to that, again, with the, a sandbox or preview, there are certain elements of working with CMS and under CMS regulations that we're kind of bound to. So we aren't really able to launch sort of an enrollment site ahead of a certain date, which is why not until sort of October. As much as we might prefer to do it sooner or have the ability to do it sooner, we are kind of limited in terms of when we can actually say, yes, you can now come in and kind of look at this in real time. That being said, again, during the training and other things, we will, I think, perhaps have demos, but at the very least, we'll have more information about what you can expect to see in there.
Yeah, the training is very comprehensive, so definitely go to the certification training. You'll learn pretty much everything you need to know to use the system. One thing, just as someone who I helped develop the training, and I can tell you confidently that, and being very familiar with healthcare.gov as well, they're very similar in terms of the application flow. So anyone who's used healthcare.gov, it's not going to feel completely out of left field, uncomfortable. It's going to be very similar feeling in that sense. It's just going to be that portal side that I think you guys will really want to get used to.
When will the certification trainings be available?
The question is about using alternative enrollment platforms like Quoted or HealthSherpa for the agents that are using that. Are we going to be able to continue using those alternative enrollment platforms?
Right. So we've been working on that question for a while. So at the moment, for the alternative enrollment platforms, all that information does eventually end up with healthcare.gov, so we will get that information. But in terms of being able to continue to use those enrollment platforms, we won't have those connections established. We went through a lot of research, and ultimately sort of the price point to benefit really wasn't there for that, at least for now, for overall, for the customer base, but understand that that's a big impact because those tools have been there for a long time to do things that healthcare.gov can't do. So for the moment, we are continuing to look at that, so definitely not ruling out, but
Say we have some information here from Michael Wallace is to talk a little bit about EDs. That way we can explain further how that's going to benefit you, even though we're not using EDs the first year. So I'll talk to that.
Yeah, thank you, Steve. So yeah, as Victor mentioned, at least initially, we are not going to have that connection available for these EDs. A lot of components that play into that decision. For one, is having everything in a single specific place and one source of truth, if you will, with respect to applications and not coming in by ways of those other platforms, and it helps to maintain that continuity. There are other factors as well as far as continuing to kind of protect consumers and that relationship that they have with licensed agents and whatnot, so that there are bad actors out there that have less opportunity, at least initially, to go in and incorrectly take applications or enrollments away from those that actually have an established relationship with the clients. So there's really a lot that played into that decision, but at least going forward, we do not have any ability to connect with those EDEs. And frankly, from a functionality perspective, this new system I think you'll be very impressed with. And I think that EDE conversation will be a lot less important at that point.
Chat.
Questions about how the system takes into account people who do not have access to email and people in rural areas.
okay, so the question was people that don't have access to email or people in rural areas that may, I'm guessing by the nature of the question, might have trouble sort of accessing sort of the internet generally, or might not be able to do that as easily as some others. What are the mechanisms for doing it without those things? As far as I know, an email at least would be required for the account information. That being said, as happens currently, I assume, helping a customer kind of make that happen could be part of the process, but there really is no way around having at least that mechanism as part of both login and kind of confirmation, sending a password reset codes, that sort of thing. That kind of starts with the email address and then with the rest of the customer's information. So yeah, not sure if I have anything to add.
Yeah, I would just add that the system is going to be mobile friendly. So if folks don't have reliable internet access on a computer, they can always use a phone or a tablet as well. And just building off of what Victor said, if shameless plug in your partner toolkit in your bags that you've got. Towards the very end, there's a copy of an enrollment records form that you're welcome to make copies of. There's a spot on there where you can put in an email address and password if you need to help a consumer set up an email. So we built that out for you, knowing that you might have some consumers who don't have emails.
Back to the room. Over to home.
So I want to come back to the OHP one and
because I do not help people enroll to OHP, but sometimes with the family, with children get OHP, and the parents just say will reach out to them. So my question to you is that all this nightly badge on the new system, do you have anything that customer who have kids or eligible for OHP see that, yeah, they have been approved or they have been denied, or see the process of, how the OHP do the verification of them? Thank you.
Thank you. So the question was, do customers with essentially mixed eligibility households, people that may be qualified for QHP, but then have a couple of members, maybe children that qualify for OHP coverage or CHIP, and how the customer receives that information or sees that information in the notices, and whether, how they're directed to kind of take next steps. So the mixed eligibility households generally are probably if you had a bucket of the thing we spent the most time kind of honing and narrowing in on through testing and through configuration with Get Insured, that's probably top of the list. That has so many different layers and things that can kind of mess up eligibility systems generally. So we really wanted to make sure that was dialed in. As far as the notices go, once each person in the household, depending on the entire household situation, is determined sort of individually, or they do have their own individual kind of assessment. So if there are some that are potentially eligible for OHP, they'll be kind of sent off with that coverage check. For children especially, most of the time that information does come back right away, because there's a certain eligibility parameters that are green lights very much for the one system. So once that nightly batch is run, and that customer gets their notification for whatever has happened that day in total, they would see broken out their individual family members and who essentially got what. So if they ended up enrolling, who enrolled in what, and then if some members of their family were determined eligible for other programs, that happened and that referral happened, and then a link or additional information about how to kind of follow up with that, since they'll be receiving that final determination separately from the one system. So we try to cut down on the amount of information the customer gets all at once, but for that particular scenario, we would want them to know individually which family members are ending up where, because we know that can get extra confusing. So there will be some things that will need to be followed up with on the one system side of things, and with one that we don't necessarily have control over, but we do give them all the information to kind of make sure that they know at least who to contact and where to go for that follow-up.
And I just wanted to add, if I can, Victor. So once you process an application, it will say that eligibility right away, as Victor said. And then the information will get sent over to one in that nightly batch. Although we won't have direct access to the one system should communicate with us. So as soon as it makes a decision, the way that the system will function, or should function, is that it should tell us if the person is eligible for OHP. So when you log into the account, you should see if once the decision's made, it should tell you if they were found eligible or not for OHP.
Let's go ahead and move on.
Oh, we have a follow-up question, Misty.
Okay, then we have time for two more, because we got to move to the next section.
So first.
Oh, go ahead.
Okay, so if we do have pending eligibility, are we still able to enroll at that time, or do we have to wait?
Yes, you can. You'll be able to enroll.
Okay.
So the question.
I'm sorry. If you have if the question was if you have pending eligibility, if you'll be able to enroll, and the question is yes, you'll be able to enroll. So if there's a DMI or something, a data matching issue or something like that, you will be able to enroll.
Okay, and then for pending eligibility, how long should customers expect for that to be sorted? Like, is it a 48 hours, 72 hours?
For them to be able to submit information, is that what you're asking?
To get their final eligibility. If they have pending eligibility, how long will it be until they have their final eligibility in there?
So everyone will have their final eligibility immediately, but then they'll just have a request for more information. So they'll need to send in information to kind of prove that they're actually eligible for that. Yeah.
We'll go to one more with the chat, and then one more in the room, and then we'll move to the next section. We will have time later to ask additional questions, and then we'll be here through lunch too if you have other questions.
We have a few questions about data migration and how that's going to work, and how these associations with the agents are going to transfer over.
Sure. So the question was, or I guess a series of questions regarding data migration and how and it might travel with a customer record from healthcare.gov, and I'm assuming some related things to that. So at a very kind of basic level, the data migration from healthcare.gov will contain all the customers' information, including the plan they're currently enrolled in. The customers being migrated are ones that currently have active enrollments in the system. So we're not bringing in any legacy data or inactive customers, only people that have current enrollments in healthcare.gov. Along with that information, if there is an agent of record, will be their NPN number. And then during the data migration process, we are working with Get Insured to make sure those NPN numbers are matched with all of the agent information we have in the system, so that those customers, again, will continue to have that association once they come into this system, just making sure it's, again, married to the information that we've got to supplement the rest of the agent information that isn't just NPN. So that's, again, kind of at a basic tactical level. Now, within that, there are certain other processes we have to go through, and Amy mentioned earlier getting the form back to us. I think I saw a question in the chat, is it too late to get the form back to us? No, definitely not. Please do that. And Amy, I don't know if you have any information about if people need that form either resent or is there... There's
Not at this time.
Okay. So
more information to come.
With more information to come, if you, again, have already gotten that message, we'll be continuing to work on that data migration, because this is something we do want to make sure we get right. So that has also been done before in other states with Get Insured. They've done that successfully several times. So we're just following that same model, making sure, again, everybody that's associated that wants to continue to be is pulled in with the customer, with that verification happening during that kind of preview period rolling up to open enrollment. So more info to come.
And yeah, just if you didn't get the form or if you haven't filled it out, just come see me and I'll.
Last question on the floor, and then we'll move to the next section. Chris?
Thanks, Missy. We have some significant market disruptions in Oregon this year. How are we handling those specific carriers, do we know, with the transfer information? Because they'll come into the system, I'm assuming, of their current carrier. Are those agents going to map, or do those people have to get re-enrolled? And I guess touching base on that is, if we look at our clients that are in those books in October, which most of these agents work in Medicare, so it's going to be a very tight time frame for us. What's the process, or will we be in testing the process we need to do to get those accounts under us if they aren't there? So it's kind of a two-part thing. Thanks.
Sure. So for the first question is, how are we handling the market disruptions, carriers leaving the market? That's obviously been big on our radar, making sure we handle that appropriately. And I understand we're going to be addressing that in a later section, so that's coming up. And then in terms of, and I'm sorry, your follow-up to that was, making sure you stay attached to customers that may be migrated from a plan that's...
Yes, if we go in there, once you guys map it, we find that, say, our health share proposal looks different than what we have in the marketplace, and we think a client should be underneath us, are we going to be able to be trained on the process of what we go through to do that? Because I think right now you have to have a significant enrollment or a change, and will your system probably just work for that for us?
Sure. So in the short term, we're continuing to discuss how things outside of the ordinary channels, which would be customer needs to request, if they're not already attached to you, that attachment happen. But in the scenario that you're talking about, which is we're migrating and there's a kind of an existing customer base and maybe a couple were missed, we can speak with our partners and Get Insured to see if there are any other options. At the moment, that is kind of the one for sure, like making sure if the customer is not kind of attached to you, that they know how to make that happen. But apart from that, if there's kind of a wider problem, that's definitely something we want to identify and have a different path or channel of action for that. And what that reconciliation might look like. I couldn't say at the moment, but I'll make sure we bring it up with Get Insured and can get back to everyone on that. So again, for the moment, we would imagine that those would just be one-offs and not really something that would happen very widely. But if especially early on, we're seeing some kind of a pattern, there would be hopefully an alternative path or channel that we could carve to say, oh, this, if you're missing multiple customers, contact us, submit a ticket this way, and we can see if we can get that rectified or validated in a different way, because we would want to make that as easy as possible for everyone. Okay, I think that'll do it for my section.
All right. Testing, okay. All right, we're going to move on to the customer service side of the consumer journey.
Good morning. My name is Katie Ortiz. I'm a Marketplace Enrollment and Appeals Advisor. And I'm going to be talking about the standardized customer service for our new Consumer Assistance Center, which will be starting during our soft launch on October 1st. So we'll be moving over to a call center with trained customer service reps. They will be using a system called Yonix, which will be used to help them work more efficiently and competently, improving their productivity as well. This will reduce their reliance on their escalations or asking for leads or supervisors to intervene on their behalf when they're stuck. It will provide customers further with higher quality responses as they will have the dynamic scripted workflows. So they'll all have a set of standard questions. Can everybody hear me now? Can they hear me online now? Good, okay. So the customer service reps will have a dynamic scripting workflow, which will have the same set of questions for everybody, depending on what the consumer is needing when they call in, depending on what their answer is, it will follow a script, and then we'll take them to the next section. As they go through this workflow process, if there's more than one issue that the consumer needs, it rounds the customer service rep back to the beginning to start with their second question or issue that they might be having. Additionally, while they're going through this process, there will be red buttons that flash to the customer service rep to highlight any of the consumer discrepancies. Like if they're calling in from a different phone number than what they have on their application, the customer service rep will get a red button that says to double check what their phone number is to make sure that we have it correct in the system. And then additionally, they will have real-time screen pops with data that is retrieved from the customer portal and passed to that customer service rep during real time during the phone call. The Consumer Assistance Center, what we're lovingly calling the CAC, consists of those consumer service reps from across the states. So the customer service reps across the states are hired across the states, but will be very specifically trained for Oregon specifics. The hours of operation during open enrollment, which is November 1st to January 15th, will be the standard 8 to 5, but then also on Saturdays from 8 to 1, and then outside of open enrollment, 8 to 5, and then closed on the weekends. There will be additionally extended dates and times during open enrollment for additional service, so you can see those dates listed on the screens, December 13th, 14th, 15th, January 14th, and January 15th. And those hours will be 8 to 8. And then we have the phone number listed here. We're keeping our main help number that we've had for quite a while, and then also our main partner assistant center phone line, separate phone number for agents and assisters.
Thank you, Katie. Can everyone hear me okay? All right. My name is Miranda Amstutz, and I'm the Business Services Manager, and now I'm going to talk to you about our interactive virtual agent, which I'm going to call the IVA or the AVA or AVA. So all of those three things are the same. So we're really excited about this new technology. When a consumer calls in, they will be able to talk to AVA, which is our IVA, which is an AI-powered agent. It has speech-to-text and text-to-speech capabilities. It also allows callers to talk in a very natural language, so they don't have to say like, you know how you get those really annoying prompts? It's like, say this, if you need this. They can just call and say, hey, I think I need to change my address. And it'll know what the consumer's wanting. So it relies on intent recognition. It has curated responses and standardized scripts that also include guardrails. And it records all interactions and generates transcripts that allow for ongoing training of the system, and then also informs our CSRs, so our call center representatives, of what the interaction was that took place before the call was given to them. It also does categorized reports that are generated for all transactions for quality assurance, so we can go back and we can see what the system is saying to people and identify any issues if there are any. And there's also 24/7 self-service for supported tasks. So there's many things that this system can help a consumer with that would not need to be transferred to a call center representative. With that, next slide, please. Our ADA, it alleviates about 30% of those calls that come in that are simple updates to their account, address changes, just wanting to check on the enrollment status, those sort of things, which then allows for our CSRs to have more time to really help people through those more complicated situations. So there's intelligent routing. Again, it lets people talk naturally. It can route calls to Medicaid, Medicare, healthcare.gov if needed, and insurance carriers. It has a user verification, so it implements a one-time password for secure authentication. There's a proactive prompt, so it verifies if there's open tickets. It checks open verifications for data matching issues, for return of mail. It checks a bunch of prompts against the person's household. It also, which is really cool, if it recognizes the phone number when you call in, it says like, hi Bob, like this is Sophia, how can I help you today? So if it knows who you are, it's just very welcoming. And we actually have a demo on the next slide. But it has authenticated user options. Again, that account administration. So it alleviates 30% of those calls where you just need to update a number, and those sort of things, and general support for all users. It's a pretty intuitive, easy to use, not complicated, less stressful for the consumer system. So now we're going to go to the next slide. And we're going to try to demo and see how that goes. Hopefully with the technology issues today it works.
Hi Sona, thanks for calling Georgia Access. I'm Ava. Press 1 for English. Fusion do paracetamol.
English.
Okay, we'll continue in English. Please note this call may be recorded for quality and training purposes. I noticed you have an open legal presence verification that still needs to be completed. Would you like to take care of that now?
Not right now.
All right, we can come back to that later if needed. How can I help you today?
Yeah, so I moved from my rental apartment and I'm not sure what I need to do with the Georgia Access account.
Thanks for sharing that. If you need to update your mailing address for Georgia Access, I can help you take care of that. Would you like to update your mailing address now?
Yeah, why not?
To help you update your mailing address, I'll need to verify your identity for security. Can you tell me your date of birth, please?
Why would I need to do that? I don't trust you.
Yes. I understand your concern. For your privacy and security, we need to confirm your identity before updating any personal information on your account. If you're not comfortable sharing this with me, I can transfer you to a customer support representative who can help you directly. Would you like me to do that?
No, don't do that. Please, I'll work with you.
All right, I appreciate that. Please tell me your date of birth in month, day, and year format so I can verify your identity and help you update your mailing address.
Awesome. My date of birth is 1st of January 2000.
Thanks for that. Now I need the last 4 digits of your social security number.
Yeah, it's 7654.
Got it. Now, could you tell me the 5-digit zip code from your home address on your application? This might be different from your mailing.
30220.
Let me confirm. Your date of birth is January 1st, 2000. Last 4 digits of your social security number are 7654, and your zip code is 30220. Is that correct?
Yeah, you got it.
Your details are verified. Would you like to receive your one-time passcode by text or email?
Text is okay.
I've sent a one-time passcode to your phone via SMS. Let me know when you receive it, and you can say it or enter it using your keypad.
Yeah, I got it. 714805.
All right, I'll verify that for you. Let me pull up your account details. One moment. Send the mailing address we have on file for you right now is 1001 East Main Street, Hogansville, Georgia 30230. Would you like to update this address?
Battery down.
I don't know.
Yeah, that's what I wanted to. Thank you.
You're welcome. Would you still like to receive a text to send your new address, or would you prefer to give it to me now over the phone?
No, can I get a text, please?
I've sent you a text message. Please reply to that message with your new mailing address, including your street address, apartment or suite if needed, city, state, and 5-digit zip code. Just let me know once you send your reply.
Yeah, I just sent it.
Thanks. You sent 101 Main Street, Atlanta 30220. Is that correct?
Yeah, you got it.
I'm verifying that address now. I noticed a couple of differences. We do not find 101 Main Street, Atlanta 30220, but we found 101 West Main Street, Hogansville 30230. Do you want to use the suggested address?
Yes, please.
All right, just to confirm, you'll use 101 West Main Street, Hogansville, Georgia 30230 as your new mailing address. Is that correct?
Yes.
I successfully updated your mailing address to 101 West Main Street, Hogansville, Georgia 30230. Is there anything else I can help you with today?
Awesome, that was very helpful of you. I don't need anything else right now, so thank you.
You're very welcome. Before we finish, would you be willing to answer a few quick questions about your experience today? Your feedback is very helpful.
Not right now.
No problem at all. Thank you again for calling Georgia Access. Have a great day.
All right, that concludes the AVA demo. We were clearly using Georgia's system for the demo because it's live there. We're currently testing our sandbox for AVA now, and everything's going fantastic. I do believe we used a slightly different voice as well. So some highlights of our demo. As you noticed, the consumer was able to use very natural language in the requests. AVA understood the intent. There was no menu, there were no keywords, there was no repeats. It was a conversation the way a customer would actually talk to someone. And there's the SMS powered data entry, which is really cool. So it gives the consumer the flexibility of, do you want a text message to go to your phone to type this up in, because maybe that's easier, or do you want to answer it by voice? It's just simpler, faster, fewer errors, and it's just a better experience, which is what we're really trying to do, is just make a wonderful experience for customers and consumers when they need to call in and get help. And I'm going to hand it back over to Katie for high call.
Thank you, Miranda.
So the high call volume process, so this will take into effect during peak hours. Under normal circumstances, the customer service rep school can be able to complete all the steps of a phone call during those shorter wait times. However, during those peak times, like open enrollment, which will be defined in our system as 10 plus callers, waiting more than 5 minutes. So this will prioritize resolving access blocking issues and encouraging self-service to reduce those handling times. So again, they can go through that AVA process if there's like a password reset or things that they can do using AVA just over the phone. The IVR messages and CAT callback tickets will help direct the callers to non-peak times again, and those self-service options. And then additionally, they will have the standard courtesy callback where it will keep their place in the queue without staying on hold. This will trigger when they've waited 300 seconds or when estimated wait times exceeds the threshold. Once accepted, they will be disconnected from the system, and then they will be automatically called back when they are up to, when the customer services are up to their queue, their place in line. Additionally, they can schedule specific callback times. If they only have like 10 minutes to be on the phone before they have to get back to work, they can say, call me back on a different date and time, very specific, and they will be able to receive a phone call back from a customer service rep during the time that they specify. And this will happen when the wait time exceeds 20 minutes or after hours if they call in and there's not a CSR answering their phones.
And I just wanted to touch quickly that there is also an interactive voice response, which is a backup to our IVA or AVA. It's just a traditional IVR. Again, it's a backup. It is not that intelligent voice recognition that walks someone through a process. It is a menu that's prompted to help someone get to where they need to or to be routed to a customer service representative. So there is a safety mechanism in place in the event that IVA or the AVA is not available. We do have a backup IVR. And that concludes that part of the customer service journey, consumer journey. Headed back over to Edie.
Are we ready for questions of the room then?
Yeah, let's do about 15 minutes of questions.
Yeah, it looks like we're a little bit scheduled.
Yeah,
So we, when we finish yours, we can probably both talk to the questions.
For sure.
Mic check? Okay. Have you guys ever called a phone number not sure he's reached the right place? In that example, it was a perfect demonstration of, am I actually talking to the company that I'm anticipating? And so my feedback isn't the question, it's kind of a question. Can we change the order that happens to where we initiate with an SMS confirming identity of both the person you're calling and speaking with, as well as the person on the phone trying to make changes, as opposed to, can I get your social right off the gate? And I'm not actually sure I've reached the right place.
I do. Testing. I do know that we have flexibility. The question was, are we able to confirm identity with an SMS text message right out of the gate versus asking for a social security number and date of birth when the consumer may not even be sure that they are calling into the right place? To answer the question, we do have flexibility with how it is set up. And I can definitely take that back to the people who are in charge of configuring it how we want to see if that's a possibility.
Thank you.
That's really great feedback.
Even in a demo, it's obvious, like, we have a problem because we haven't demonstrated authority that we're having the connection that we're intending.
Yeah.
Because I've called and it's actually the wrong number by 1 digit. I didn't realize it, and I'm having a conversation that's going nowhere fast, but they want my information.
Yeah, no, that's really good feedback. Thank you so much for that.
I think I have one question in the chat.
Okay, for the callback, how long do they have to answer the phone before the service rep cancels the call?
She said thank you, and she's got to get it filled up.
The question is, how long do they have to answer the call before the customer service representative cancels the call? It is automated. and I do not know how long it rains before it is canceled. That is a great question to take back and find the answer to. So thank you for that.
That's at home. For AWAR, if I were a customer, I always say something like, I want to change the address and I also want to update the income. Would that AI be able to take that, like the multiple requests at the same time? And another question is to go on that after we change the address or update the income, does AI take the caller to the end of the application to sign the paperwork again? And another question is, do you have an agent hotline? We can call you for customer. Thank you.
Thank you. To answer that, yes, we do have a do we have an agent hotline or phone number call? Yes, we do. It's called the partner number. I think it was like 3 slides back.
Yeah.
It is 833-OR-PLANS or 677-5267. It is also in your slide deck on slide 25. So yes, there is an agent and community partner phone number. The other question was, can our EBA take multiple requests at one time? Yes, it can. It can do one request after another. However, one of your questions was, can it update income? It cannot. So it can do contact information, check application status, and get routed over to another place if they're not calling in, like if they need to talk to OHP or Medicare. So they cannot do like income updates. However, it will then be routed over to a CSR at our call center if they're needing to do additional tasks that the ABA can't do.
On to Shannon.
I had a couple questions about the CSR. Are they local? And are they employed by the state or is it a contractor? Does that contractor support other businesses? Are they employed now? Are they there, like being trained yet? And then if there are changes that are made, are we notified for agent of record? And then I also wanted to confirm the IVR backup, which could let a client transfer to an agent, would only be like a backup. That wouldn't be anywhere on the front end of any of this tree. Sorry for a lot of questions.
Okay, it's a lot of questions. I'm going to try to answer them. So I'm going to start with the last one first. The question was the IVR, is it backup? Yes. However, it is used right out of the gate when it asks, like, is this call going to be in English or Spanish? That is the IVR. And then it continues the call with the ABA once the language is identified.
Okay, I thought the third party transfer if necessary.
Yes.
Okay.
So it's a backup to the ABA.
Okay.
Yeah, so if the ABA for some reason goes down, it would just be IVR and there'd be a phone menu in place.
So the
for the
consumer
consumer.
client could get to an agent.
Absolutely.
Okay, they couldn't do through the tree.
There would be a selection to.
Before the backup.
Yes.
Okay.
Yes, so in AVA, there is still an option to get to an agent in AVA. Yes, yeah.
Yes. Your other question, is our call center or CAC local? I believe we are trying to hire representatives local in Oregon. It will not be managed. It will be managed by us and a contractor. So the contractor is hiring, and that is Get Insured. So it is our vendor that we're going through for our whole solution. So it's not like a separate entity. And I believe training will be commencing shortly because they're in the process of hiring now. Yeah.
Thank you.
You're very welcome. Did I miss anything?
No, that's good. Yeah.
I-
Knowing it's Get Insured makes me feel good.
Yes.
There was one thing that you had asked Shannon was if there are any changes, if you would be notified.
Oh, yeah.
And yes, anything that happens through the IVR is documented in the system as if it was happening by a CSR. So it is in the system, and as the agent of record, you would be able to see any change.
Would that be though a push or like I could go in and see it, or would we be notified like, hey,
5 of your clients made these changes yesterday?
There is a notification that is sent out that I can't remember if it's notices or changes.
Okay.
But there is a specific notice. I have it on another slide, so hopefully it answers your question.
Will the callbacks be double dialed to give them the best opportunity, or will they have to get back into line and start over?
The question was if they receive a callback, will they have to get back into line and start over? And the answer to that is the callback holds their place in line, so they get the callback when it is their time in line to be helped.
Do we have any more?
So this is just a question specific to the partner line. What is our experience when we call in as a partner agent? Do we get priority answer? Are we going through this AI system? What does that experience look like for us as agents?
So you're going to have the same options using Ava, but you can skip out of it. You are a separate line with separate staff that staff that line that are trained and skilled as partners.
If we have clients that have like some really specialty health needs and they are eligible for OHP, but they don't want OHP, they would like to buy a private health plan, are they going to be subsidy eligible?
So the question is if a client is eligible for OHP, if they would be eligible to purchase through the marketplace with a subsidy if they don't want OHP. And the answer is no. Eligibility for financial assistance will remain the same as it's written into the ACA. So you can't be eligible for other minimum essential coverage, which would include OHP programs.
So for Ava, if a client calls in who has a data matching issue and has submitted documents, is Ava going to be able to tell them we've received your documents and then what the status of those is as far as pending and review, they were approved, confirmed, or denied?
The question is if someone calls in, will Ava be able to essentially, if they have matching issues, give them like the update of the documents, the status of it, and then the answer is yes.
I guess let's say a existing client calls in to one of the customer lines and has an NPN already signed to them, and it goes to a third party and transfer out to an agent. Does it go to the assigned NPN agent first, or does it go to a general agent pool to where we might have an NPN change or anything like that happen under those circumstances? Does it look out for that, or is there some calls to customer line that goes to the agent? It's, well, that's fair game.
Thank you. That was a great question. I believe the question was if someone, a consumer calls and there is an agent on record and they want to go to an agent, does it search for their agent on record first or just sends them to a random agent? We do not know 100% for sure. I want to say yes, it looks for the agent on record, but I can't confirm that at this moment, but we will take it back and find out. So that's a really great question. Thank you.
Ava does know who your agent is though.
Yes.
Your market that is, you haven't changed, your NP is attached to that client. It will say, oh, I see that Scott Littlejohn was your agent. Do you want to speak to Scott Littlejohn?
Thank you.
We have a question online.
Yes. Actually, the second question kind of encompasses the first. If someone calls to finalize an enrollment for change plans and there is an existing AOR, will the AOR stay? Or if they lose this for calling in and helping modify or finalizing an enrollment, also, what will the process be for changing an AOR if they have one listed but want to switch?
So the question is if the agent of record, if I'm understanding the acronym correctly, will stay the same basically if there's a change made to an account? Is that?
Yes.
This not, okay.
If they're calling in to help modifying or finalizing an enrollment.
Yeah, so the agent of record would not change unless there was an explicit request to remove or change the agent of record. So a client could go in and say, I want, this assister to help me instead of this agent, and then they could go through the process to get reassigned. And the certification training does talk more about that, so we'll kind of save that for the training, leave you guys on bated breath. But there is a process for that. But unless they request that change and go through that process, then no changes would be made to the enrollment partner assigned.
And can enrollees assign an AOR if they phone enroll?
Yes, it is a two-step process that involves both the applicant requesting the enrollment partner, and then the enrollment partner also has to approve it. So it's yes and no. Well, I guess I'll just tell you guys now. So if a client goes in, as Victor was showing you the Find Local Help tool, there's an option to request that person to be your assistant, your assister, or your agent. Once you hit that button and complete the request, it gets sent to that assister or that agent, and then you would get a notification on your portal that you have a pending request. And so then you would be able to go into that pending request and say, oh, John Smith wants me to be their agent, and you would be able to see some basic information like email and phone number, and approve or decline it. And then they would get a notification on whether you accepted it or not.
I think they might be asking about people who apply on the phone, like with an agent. Can they still assign with a CSR?
Yeah, even if it's on the phone, it would be the same process. Yeah.
Okay, kind of back to the eligibility question about having the OHB and wanting the marketplace plan. Is there an option, or can there be an option for somebody to check a box that says, I know I'm on OHB, I want a full price plan, no subsidy involved?
Yes.
Or do they have to go through like a just direct to carrier in that circumstance?
So the question is if someone can enroll in a full price plan through the marketplace if they are eligible for OHP, and the answer is yes. You can submit a non-financial application, and it's actually a very short application because you don't have to submit any income or other.
At that point, will that be communicated back to OHP so that when they file their claims with their carrier, they don't have to deal with coordination of care?
Unfortunately, the question is if it will be communicated back to OHP, and unfortunately, I believe the answer is no.
They would have to unenroll on OHP.
Yeah.
Hi. During the open enrollment, why the limited hours for the customer service representatives? Not all of us work a true 8 to 5 day, especially during that window of open enrollment.
I can answer Gertrude, you can answer it.
Good morning. The question is, during open enrollment, why are there limited hours? So we are trying to be respectful, of course, of everyone's time. We do have some extended hours, especially for specific days. So, for example, the day before open enrollment ends, and so on and so forth. So there's a whole list. And please know I am stumbling because we are recently adjusted our open enrollment dates because of the recent court decision of Columbus One. But please know, it comes down to cost too, right? So 8 to 5, yes, we recognize that, but it is also, we have to balance cost for running the call center and also making sure that we have all the available tools available. So we recognize that this could cause a hardship, but please know we will be taking feedback, especially for this first open enrollment season, and we'll make adjustments as needed.
The other thing is we're working with Insurance, as you know, they have several other states that they've done the same thing for, right, launched SDMs. And we looked at all the data when the calls specifically come in, and when there's high call volumes, and what that made sense for hours to support those call volumes based on what other states did in the past, and this is partially how we landed on those hours as well.
Chicky, can you confirm the OEP date again?
Well, since you're so excited to hear about the OEP days, so in case you weren't following the news, right? So the federal government, through the program integrity rule, and I hesitate also because there's so many federal changes that were announced last year. So it was the 2025 program integrity and affordability rule that mandated all states and even FFM states to shorten their open enrollment. There was a court case last year, it's Columbus versus Kennedy. That was last year, and there was a court decision by the Court of Maryland, I think late May, early June, that vacated that provision. So because of that court decision, we are allowed to keep our existing open enrollment period. So our open enrollment period for this year, we are working towards finalizing November 1st, 2026 through January 15th, so no change. We're looking, of course, to provide everybody as much time as possible to sign up for health insurance. So again, that is our current plan for this upcoming open enrollment period. It is 11/1/2026 through 1/15/2027. So same dates as always.
And you might have saw in the updates, if you're at some of the collaboratives, that date was December 31st, because we were sharing that. We just found that out this week.
So yes, as of yesterday, we got guidelines from CMS that they will be very flexible. They recognize that this is a last minute change. All the states are scrambling to figure out how to operationalize various open enrollment dates. So I got the clearance yesterday, and my core team have been scrambling left and right to try to make adjustments where possible. So please bear with us as we work with the federal government. We work with DOJ, all the people we need to work with. But that's the plan as of today. Same open enrollment dates as years past.
I think we'll do one more question and then we'll go ahead and move to the next section.
It would be lovely if the state of Oregon or any other state, as far as that's concerned, would have an earlier open enrollment, like say October 1st through December, whatever, okay? Having it, believe it or not, there's some people that are like what I would call procrastinating personalities, okay? And then the weather gets out there, and then the holidays come. So the plan's already filed with the state well before November 1st. So why can't it be October 1st?
Thank you. Ooh. Thank you for your question. And the question was, if I can summarize, is why can't we start open enrollment sooner than 11/1? So at this time, we are mandated by the legislature through Senate Bill 972 of 2023 that our open enrollment on the state-based marketplace platform starts on or after November 1st of 2026. So that's for this year. We will continue to look at what the federal government will allow us, because I do know that there are some states who are starting sooner. I think there are some states who are considering starting like October 15th. So we hear you, as excited as we are to start sooner. We are kind of restricted this year because of what the legislature has allowed us to do. But could we open it next year sooner if we are allowed to do so? By federal provisions, we will definitely consider that. Thank you for the feedback, and we will please continue sending those to us. We completely understand.
We also want to be mindful of Medicare open enrollment because we know a lot of our agents do Medicare too, so. All right, well with that, we'll go ahead and move to the next section. So I'm going to actually talk a little bit about communications, which I always love talking to everyone about. So I'm really excited to be sharing with you all kind of a preliminary concept for ExploreHealth.or.gov, which will be the landing page for Explore Health. So you'll want to make sure to bookmark that URL. Don't go there yet because it's not working. But on the screen here, you'll see kind of a mock-up of the design that we have going for the landing page. The concept that we have is very simple navigation, clear messaging, using graphics to help individuals with limited English proficiency, and making sure that our imagery is representative of the people that we serve. We actually just wrapped up a shoot, which I'm really excited to share with you all, that is really representative of folks here in Oregon. It's actually includes real families and real people here in Oregon in their homes, so it's actually really exciting, and we'll be featuring those on our site. Additionally, I wanted to share the site map with you, and I know this is a lot of information. We have a lot of information that we want to make sure is available, of course, to all of the different people who are using Explore Health for coverage or looking for health coverage out there. So what we went ahead and did is broke down the information into the different kind of categories of what folks might be wanting to do on our website. So we might have folks that are exploring health coverage or shopping for health coverage. Maybe they're coming to our site because they need help using their coverage or maintaining their coverage or renewing their coverage. So we've broken down these categories, and you can see that there's different buckets of information. This information is already built out. It's very comprehensive, but it's also intentionally written in plain language so that you don't have to have a doctorate degree to understand how to submit a life change, or what the definition of a deductible is, for example. So we've put a lot of work into, as I mentioned before, into making sure that the system is as easy to navigate and use as possible. One thing I do want to mention is that our Explore Health website will have a link that goes to the plan guide, which is what we're calling our plan comparison tool. So you will, after October, you will not hear us really call it the window shopping tool anymore, but we will have the plan guide. And then based off of the results from the plan guide, folks will be routed to either the One Online system to apply for the Oregon Health Plan program, or to Explore Health to apply for Marketplace, or of course to our local health finder to get help from you all, which will kind of be the forefront of what we recommend for folks. One thing that I do want to mention also in the plan guide, which is pretty cool, is when folks go through, if they're eligible for a Marketplace plan and they find a plan that they like, and they decide that they want to fill out an application, then it'll actually remember what plan they like, so they can go through the application, and then once they get to the enrollment piece, it'll keep that plan information. So they don't have to go back through the list of plans again and go, what plan was it that I liked? So that makes it a little bit easier to go through the process. Speaking of our local help finder, so this is the kind of dashboard, if you will, or launch pad for the local help finder and what that will look like. When a user accesses the local help finder, at least for this year, it will segment out for our assisters and our insurance agents. There is a special note under the insurance agents. Well, both of the groups, there's a note under them, but for the insurance agents, we do let folks know that only insurance agents are allowed to give plan advice, because we do want to make sure that folks understand that delineation in case they need a little bit of extra guidance in choosing a plan. So just wanted to make sure that you were aware of that. And to Victor's point of what he said earlier, the insurance agents will all be listed individually by agent. And then the assisters will be listed by organization. And the organizations will be listed at a primary site level. So if you have multiple locations, You will be able to add sub-sites to your organization. It will come up under your primary site, and then folks will be able to drill down to see if you have additional locations where you're offering help. All right, I know that this is very small, and I'm sorry for that. But also, we have a lot of different notices that we're sending out, and if you attended our listening sessions earlier this year, you might have seen this list, so I apologize. But this is a list of all of the different notices that we currently have set to go out in the system. We have 3 different groups of notices that will be sent. We have notices for customers, notices for partners, and notices for employers. I do want to mention that you will, as enrollment partners, have access, as Victor mentioned, to your client's dashboard. So you'll be able to go in and see their notices and see what was sent to them. You will also get a notification if someone was sent a notice as well. And Shannon, you asked a question earlier. There is a daily book of business summary that you can get sent. So I will get more information on what's included in that. But you can basically get just a summary every day on kind of what's going on with your book of business. So there's a lot of different things that are sent. These are all sent really dependent on the communication preferences of the individual. So if consumers prefer email versus paper mail, then that's how they'll receive them. A lot of times they'll get a text message notification in addition to an email. And of course, the notices will be in their online system as well. So if they, for some reason, the Postal Service, it doesn't get to them, they'll have it as a backup there.
Katie, this is Zach. Can you hear me?
I also wanted to share with you just the general notice structure, and this is just a sample, but all of our notices will be structured in this general way. For mostly our eligibility notices and renewal notices. They'll include a barcode at the top so that if they need to return any information, if they include that notice with it, then it'll be able to get scanned by the system, so it'll pair right with their account. It will also include, it'll have updated to our new branding, so everything will be Explore Health branded. It will reference the Oregon Health Plan generally. So in our notices, we are not going to say you might qualify for OHP Bridge, or you might qualify for, OHP CHIP or whatever. It's just going to say you might qualify for an OHP program. And then we're going to send the information to OHP, and then they'll decide what you qualify for and let you know more on that more granular level. We just really want to avoid confusion, and we don't want to give any misinformation on our end. All of our systems are built to ensure that there's consistency and that everything is automated. So we've got everything in templates with kind of pre-filled or spaces where things will kind of get pre-filled. So I'll show you kind of an example here of the next steps. So on the eligibility and renewal notices, we do have these next steps that will be included. And you'll notice that they're pretty comprehensive. They include things like reminders on how to update your information or change your plan if you need to. We make sure that folks understand, we'll update that date. Like Chicky said, we're still working on that. But we want to make sure folks know those deadlines. For example, the renewal notice, we want to make sure that folks know you're going to get renewed, auto-renewed, but if you want to make a change, you can still do that. Make sure you go in during open enrollment. This is your deadline. This is how to do that. And then we always are going to point people to local help. So we include that in every single notice is going to include information about how to find help either through our customer assistance center, our online system on our website. We will have a live chat agent that's available 24 hours a day. So that will be available. or through an enrollment partner. And then, of course, we'll always include the information that if somebody disagrees with the decision, what steps they can take to submit that disagreement. So this is just for the month of October, and it's definitely not comprehensive. We're still building out our open enrollment plan. But this wanted to give you a little bit of an idea for what the notice plan is looking like or shaping up to be for October. So as Victor mentioned earlier, we do have some kind of pretty strict rules on when we can start doing notices to consumers. And so basically what will happen is our friends over on the federal side will send a notice first that says, you are enrolled through healthcare.gov. Oregon is not using healthcare.gov anymore. They're moving to Explore Health. That notice we're hoping that will land in mailboxes somewhere around the first Friday of the month. And we will follow very, very quickly with a notice from Explore Health that says, hi, we're Explore Health, and this is how you can get into your account. We don't want to overwhelm people too much, so we're just going to give them information about how to get into their account. We will also send a general newsletter, just kind of letting folks know, like, hey, we changed over to Explore Health, and this is what you need to know. And then as the month progresses, we will continue to send more and more information to build on that communication, to let folks know, we'll send a renewal notice, we'll send text messages, things like that leading up to open enrollment so that folks hopefully feel prepared. We're hoping to have, the tentative plan is to have our plan guide open by the 15th of the month. We're hoping to have it open sooner, but we'll see what happens. And so we will send a notice to all of our current enrollees once that plan guide opens to say, hey, all of our plans for 2027 are up on our website. You're welcome to take a look at them and see what's available. I don't remember who mentioned it earlier, but we totally recognize that there's a ton of things happening in the market this year that are impacting thousands of people. And so we want to make sure to give folks enough time as possible to really assess their options. So we will be giving a lot of information about that. And I do want to mention that we are working with those carriers very closely on their communications to try and help people make that transition, whether they're enrolled through the marketplace or not. And then lastly, I just wanted to give you a little idea of our campaign map. So we've got a couple of different campaigns kind of in the works. The first is our brand awareness campaign. The brand awareness campaign will start in about September. We're a little bit squishy on the date right now because again, we're kind of in planning stages. But the intent of the brand awareness campaign is really to do just that, to build awareness of the Explore Health brand. We recognize that we're building a brand from the ground up, and so we want to make sure that folks really know who we are. We want to build trust with the folks that we're serving and with the folks around Oregon. Our great outreach team has done a phenomenal job with building brand awareness around OregonHealthcare.gov, and so they will really, hit the ground running with a ton of materials and swag and things at events to really build awareness of the Explore Health brand. So I do want to mention, I guess that begs one comment. You all got swag today, and you all are now in on the secret of the Explore Health brand, but we're not sharing it publicly until September, okay? So we have to ask y'all to keep the secret, okay? So we are planning, though, on running a coordinated outreach campaign, not just with our outreach team, but across digital and print and other community channels. We're exploring what that looks like now. We want to make sure we're reaching people in all areas of the state. I'll never forget when Vixen told me that, we got to put it on the side of a silo. So we're looking at those options too. And we're really looking at what that message looks like and making sure that those messages are clear. And laying the groundwork for what to expect, whether you're currently enrolled or whether you want to get enrolled through Explore And then on November 1st, we will shift strict to our open enrollment. We'll kind of build up to open enrollment before then, but November 1st will be when we kind of hard launch that open enrollment campaign. And that's when we'll really move to kind of what we traditionally do, but on steroids, if you will. So we'll have paid media, out of home, digital, social media, search, ads, print, broadcast. We're gonna hopefully activate some influencers on social media. I don't know if you guys have seen those before, but we've had some great partnerships over the last couple of years that have really been great for us. We'll have some organic posts, so you can pre-save or follow our Explore Health social media channels now, because we're going to be pumping out messages there and you can save them. And then we'll also be sharing with you all some partner toolkits. So if you all have social media channels that you want to share messages on, we will give you messages that you want to that you can just kind of copy and paste and plug and play. We'll also give you some newsletter messages, some kind of Swiss cheese press releases, if you will, and different things that you can use. So we want to make sure that you all are able to kind of help activate and spread awareness for open enrollment and for the work that you do, in addition to us and our campaign. And then of course we'll continue with our outreach team will continue to be boots on the ground in community, going to events and providing support. So that's all I have about the communication stuff. We can open for questions. We've got about 15 minutes until the next section.
Yeah, 15 minutes, and you can start with these questions, and then if we have time, we'll circle back some of the other questions from previous slides.
I think most of my clients do not have healthcare.gov accounts, but they have healthcare.gov applications. So when they get that message and they go to healthcare, do you know what's going to happen?
So the people who will get notices from the question was, most of the clients that this individual is asking have healthcare.gov applications, but not necessarily healthcare.gov enrollments. Is that?
Accounts. You don't have accounts, they have applications.
Oh, they have so are you using like an EDE platform?
Yeah.
Okay, so
Health Sherpa, they don't set up healthcare.gov accounts. They have healthcare applications. If they make a healthcare.gov account, they have to go in and find their application and get it matched up.
Okay, so using Health Sherpa, they have a healthcare.gov application, but they don't have a healthcare.gov account. Okay, perfect. Thank you. Sorry. So we are currently working through a very long list of folks. We've got a lot of insurance agent information that we are kind of matching up with the enrollments that we've gotten from healthcare.gov, and we're trying to make sure that we can make those connections right now. Any enrollment through healthcare.gov that has an NPN assigned to it will transfer over with that NPN. So whether it was through Health Sherpa or directly through healthcare.gov, it should transfer over, okay? That being said, there is a form that we need you to fill out so that we have all your information. So if you haven't filled that form out, please see me. And I do want to mention that up until this point, we have had kind of limited contact with our agents because most of everything you've done has gone through healthcare.gov. So we are right now working very hard to connect dots so that we know who all these NPNs belong to. So apologies if...
Clarification,
yes.
I'm not worried about the transfer of my information. It's just for the client facing when they get the email from the state notification. What is it going to say? You're moving your healthcare.gov to... So what is being... publicized to the person who's enrolled through healthcare.gov, but they don't have healthcare.gov accounts.
So we can share with you, I believe, the notices that are being sent from CMS. Yeah, so we'll share with you the notices that are being sent from CMS in advance. Sorry, I was just making sure. What I believe they'll say, based off of what I've seen from drafts, is that you are currently enrolled through healthcare.gov and the state is moving to a state-based marketplace, so your enrollment is being moved to that system or something to that effect. And then our letter will say, we've created an account for you. This is how you claim your account.
So they will have an account?
Yes, yes, absolutely. And they'll have a little access code, so they don't have to actually go in and create a whole new account. They'll just go in and put in their access code and it'll kind of populate everything. Yep, sorry.
Question here from Jason.
So as an agency owner, we have multiple downline agents that work for us. Situations change, an agent leaves. We lost a good chunk of some book of business because the marketplace doesn't allow AOR changes that way. So how is Explore Health going to differentiate that or make that work? Because then the question is, like, if we all put it under the agency, there was a question earlier, it was an agency question. Who becomes the agent of record? Is it the licensed agent or is it the agency? As the principal, is it my NPN? Is it the agent who writes it? And if they leave, how does that work to stay with the agency? Because they're a licensed only agent, or that's how they set up.
Yeah, no, that's a great question. So the question is an applicant assigned to an agent or an agency? And if the agent leaves the agency, what happens to that client if you can transfer their book of business, or what kind of, if they go to the ether? Is that, yeah, okay. So the clients will be assigned to the individual agent for their NP based on the NPN. But you will, as Victor was showing earlier on those screenshots, you will be able to go in as the agency manager and transfer the book of business, whether you want to do it in bulk. You can do like their whole book of business. You can just transfer to another agent within your agency, or you can do individuals to transfer to a different agent.
So then, like in Medicare, when we transfer books, the agent who's transferring it to the agency has to approve it. Does the exiting agent have to approve the transfer to the agency?
So the question is if the exiting agent has to approve, and I would have to, Michael, do you know for sure? Because I believe the answer is no, that as the agency manager, you have the authority, but we can find out for sure.
And then the new agent would be the principal of the agency?
Would be whoever you assign.
And then other agents in the agency are they allowed to see and work that book then if they're not the NPN that's attached to it, but it's under a different, as like a servicing agent?
So the question is if other agents within the agency can work on a client's account if they're not the primary agent. It depends on how you have the account set up. We can get more information on that from Get Insured for you, so that we have the exact specific nuances. But I do know that it depends on the specific permissions of each individual, what they're able to do.
Would the consumer be notified that they have a new agent?
The question is if the consumer would be notified if they have a new agent, and yes, they would absolutely be notified. Yes.
But they don't have to agree to that?
Oh, the question is if the consumer has to agree to the change. And the answer is yes. I can't believe that's the case.
We've got like 3 different answers on that one now.
We'll get clarification.
He gets the microphone to you, so until you can answer the question, ask a question.
In the event that you move your book under a different agent in your agency, is everybody that was on that book, all your clients are going to be notified that you're no longer Nicole Betts' agent, now your Capex is your NPN.
So
your AOR?
So the question again is if people, when they're moved, if they get notified of the move, and the answer is yes.
And do they have to agree to that? If they say, no, I don't want to, then what happens?
And the question again is if do they have to agree, and what happens if they don't want to? Well, I
think Michael has his hand up.
oh, Michael, I'm gonna point to Michael.
So to that question as to whether the consumer has to agree, the answer is it really doesn't matter because the consumer always has the ability to assign a new agent, request a new agent. That's completely the consumer's right. So the consumer is not stuck with anybody ever. They can always elect that, well, they moved me to this new agent, fantastic, or not fantastic, right? I'm going to go ahead and request a new agent. Then the agent gets that request and has the ability to opt in or opt out of that request.
What if they never pay attention to they've got a new agent?
Well, I do think that's part of why we always advise folks to pay attention to those notifications. I mean, at the end of the day, we can't control everything, right? But we do notify, and it is up to the consumer ability to be following those notifications.
But we can get clarification on if they need to approve the specific change.
Okay, yeah, I think that's where some of the confusion is on this side from some of the other agency managers here is this require an affirmative approval from the client before this transfer happens? Because if I have an agent that leaves and has 300 clients, I transfer, they don't say yes, I now lose 300 clients worth of revenue. That's the problem we're trying to look at.
And someone can correct that property.
I appreciate that clarification. I just want to comment on that too, and I think that's one of the challenges brokers are working with in the market right now, is we have Medicare and individual, you guys are launching a new marketplace and you're making our participation, hopefully to help get people enrolled. If we can't construct or retain that revenue or that book of business, you're gonna see a lack of participation in the program. And you've seen that with the FFM, even Sherpa, like somebody leaves, you have to do a completely new enrollment, which is restricted to get the NPN over to somebody else, and so the value of a book of business to be sold or transferred is basically, to the market. So if this system just does that again, it's going to create a lot of challenges for agencies to want to participate, and you will see probably only sole shops participating. So it's just a comment to see if there's any solutions on it. So thanks for taking it.
Thank you for the comment.
I have a question online about what protective measures are in place to avoid unauthorized AOR switches.
Yeah, so again, the question is what protective measures are in place to avoid unauthorized agent of record switches? So in order for an agent of record to be changed, at least externally to a different agency, the consumer and the agent both have to agree. So there is a message that is sent to the consumer. They'll receive a PIN code and they have to provide that PIN code as verification. So if they can't provide the PIN code, and the agent can't get that PIN code, then they can't get assigned. Any other questions? We can do one more, I think.
I just had a question that's not about the AOR, but as you're moving the data information over from this government over to the state system, is the 1095A forms going to be sent over as well?
Oh, that's a good question. So the question was if the 1095A forms are going to get sent over along with the rest of the data from the federal system. And the answer is no. And I know, I'm sorry. Anything that for plan year 2026 or prior will stay with healthcare.gov. So you will have to they will need to go back into their healthcare.gov account to get their 1095A form. I'm sorry, you have one more year. But everything for 2027 on will be through us. Sorry.
But would Health Sherpa still give us access in January?
Nothing will change for 2026 or before. So I'm not familiar with Health Sherpa. Sorry, the question was if Health Sherpa will still work to get that information. I'm not familiar with Health Sherpa, so if Health Sherpa gives you access to that, then yes.
I was told yes.
Okay, thank you. We have someone who was already told yes. All right. I want to thank Katie, Miranda, and Victor for their time. We were running ahead of schedule, so they were up here a lot longer than we had planned. So thank you. All right. All right, well, Next, we're going to turn our attention to what's ahead for open enrollment 2027. As we prepare for the next enrollment season, it's important to have a clear understanding of the upcoming changes, key considerations, and what you can expect as we continue to support consumers. So as you listen, we consider you to think about what this means for your conversations with your clients. What kind of questions do you anticipate hearing? What kind of support do you need? We'll have time later this afternoon to continue conversations with our outreach team. So that'll be a good time to share what kind of support you need. But I want to introduce Katie Button, who many of you may know because she's been with us for a long time. She is our Plan Management and Policy Advisor. Katie, thank you for being here, and I will turn it over to you.
Hi everybody, it's so nice to be with you all today. I hope folks online can hear me okay. I will try to speak slowly, which is not my forte, but I really want folks to hear what I have to say today so that you all can be informed. And now you're going to watch me struggle with technology because I have to advance my own slides, and I am very spoiled these days and do not usually have to advance my own slides. Well, let's see. Amy, how do I make it go to the next one on this slide? Sorry. Yes, if you would advance them for me, that would be amazing. I'll just slide this thing right over here. Thank you so much. We can be friends. I love it. Okay, so we are going to have some changes for open enrollment this year. Chicky already gave her little spiel, but I'll just reinforce that we will have open enrollment will be from November 1st, 2026 through January 15th, 2027, which is typical. What is not typical is that all enrollments received by 12/31/26 will be effective for 1/1/27. So that is not how it has usually been. So that will give folks some extra time to get in December and still have 1/1 enrollment, and then enrollments received from 1/1 through 1/15 will be effective February 2027. We will have some eligibility changes for 2027. Due to some of the federal changes, there will be some folks who will not be eligible for tax credits this year. They will still be eligible to enroll in full price plans, they just will no longer be eligible for tax credits. And so those are folks who are non-citizens who do not meet the definition of eligible aliens. And so that is mostly folks who are refugees and asylees, folks who have green cards, folks who are lawful permanent residents, folks from the Kofa Nations, and then Cuban and Haitian entrants will still be able to receive tax credits. So the system will update some questions for folks about their immigration status, and then we'll let them know if they are not eligible for financial assistance due to that status. We also are theoretically having income verifications reinstated, so that would be in instances where someone reports income that doesn't match available sources, either from the IRS or some other financial sources that we might have access to. This provision is currently part of the second City of Columbus lawsuit, so that was the lawsuit that was filed this summer, and so we don't know if the court will decide to stay that provision, which means it won't go into effect. We are currently planning for it to go into effect, so be prepared that folks might need to be able to provide information like a pay stub if they have income, especially in these situations where they have income that changes or they've had multiple jobs during the year. So just be ready for that so that folks can get that information so they can get their financial assistance. And then the other big change is Medicaid work requirements. So those are set to go into effect January 1st, 2027. And so for folks who do not meet the Medicaid work requirements and who are removed from Medicaid, they can purchase full price health plans, but they do not qualify for financial assistance.
What are work requirements?
So, work requirements are something that was passed in the One Big Beautiful Bill Act last summer, and they require people who are receiving Medicaid to prove that they either have some work, they are students, or they are taking care of a relative in order to continue to qualify for Medicaid. So people who do not meet those work requirements will not be eligible for Medicaid, and they cannot be eligible for financial assistance on the marketplace. We have two medical insurance companies who are leaving the market at the end of this year. That's Providence, who's leaving both the individual and small group markets. Pacific Source is leaving the individual and shop market. They are going to continue to offer small group plans, but they will not offer shop plans. And then Dentegra is leaving the individual market, and they offer individual dental plans. We will still have several insurance carriers for statewide medical. We have Bridgespan, Moda, and Regents. We'll continue to have Kaiser that does kind of the I-5 corridor. For dental statewide, we'll have Dominion, Delta Dental of Oregon. Humana is entering the market this year with us, and then we'll have Dental Health Services and Kaiser who continue to kind of do that I-5 corridor. So for network changes, because Providence is leaving and because Providence was the only insurance carrier that had Providence facilities consistently in network, Regents has added a new network. So that's the Prov network that's on the far right, but I'm going to start on the left. So they have a couple of network changes this year. So the Icon network is similar to the current individual and Connect network. What will change about it is that it will not be offered in the Tri-County area. So it will be available statewide except for the Portland area. They will also continue to have the individual Connect network. That will be statewide, it's only the standard plans. They'll continue to have their legacy network. It's now called LHN. It will be available in the counties it's been offered in for the last several years. And then the new Providence network, which is available in the Tri-County area. That's through Regents, yes. And then Moda is also making some network changes. So they'll have their statewide select network that's still in place, and then they will offer a Pathways network for 2027 that includes the Providence facilities and providers, and that is, again, available in the metro area. Can I take questions? Or do you want me to? Okay. So what is going to happen to the folks who are in the Providence and Pacific Source plans? So we will crosswalk them, which we do and we have done before, but it's been quite a while. So I wanted to remind folks of what happens when a carrier leaves either a service area or the whole state. So we pick a plan for them, and we have a couple of criteria. I try first to look at networks and see which networks are the most similar. Then I try to look at plans that have similar benefits. Obviously, the standard plan is easy because you just crosswalk someone from one standard plan to another. But when it's not a standard plan, I look and try to make sure did it have a lot of pre-deductible coverage? Did it have certain services that one plan might have and another plan doesn't have? So I try to make sure those are similar, and then check for the one that's the lowest cost. People can always pick a different plan. They are not stuck in the plan that we choose for them. It's just a backstop for them to make sure that if they do nothing, they'll still be auto-enrolled. And so if they don't pick a plan, they'll go into the one that we auto-enroll them. I don't have the crosswalks done right now. I'm still in talks with the carriers, trying to kind of figure out what is happening and what is shifting so that I can move folks to the plan that works best for them. So when we do have that information, we'll post it. It'll be available on our website. We'll send it out through our newsletters. And so that you will be able to see like this plan crosswalks to this plan. And then just a reminder that all Bronze plans are HSA eligible. So a health savings account is a pre-tax account that folks can put money into, and then they can use that money to pay for things like doctor visits. And previously you had to be enrolled in a certain type of Bronze plan, or it could have been a Silver plan as well, but a certain type of plan in order to be able to contribute to that account. Last year at the end of the summer, new legislation was passed that enabled all Bronze plans to be eligible with those health savings accounts. So if you have folks who have a health savings account, I really encourage you to have them look at other plans. There's a couple of different things that are happening. One is that I call them the traditional high deductible health plans, which are the plans that do not cover anything ahead of deductible. Those plans usually aren't cheapest. There are usually other bronze plans that are cheaper, and then any plan that has pre-deductible coverage, your money in your HSA will go so much farther. For example, if you're using the standard bronze plan, the office, first of all, there's 3 $5 office visits on that plan, and then all the PCP level visits are $50. $50 is a lot less than a full price PCP visit, and so again, that money in that account goes farther. So I really expected that I would see enrollment in those plans dip this year, and I did not in the traditional high deductible health plans. So I would love to see folks moving out of those plans and moving into other bronze plans. One last thing I'll mention is that when we pass things like state mandates that mandate benefits that are free, like hearing aids are free on the standard bronze plan. They're full price on one of those traditional health plans. So really want to make sure that folks are taking advantage of bronze plans with pre-deductible coverage, even if they have health savings accounts. Okay, sorry, I know I got faster there at the end. I am ready for questions. Shannon was first, and then we'll come to you now.
How many can I ask?
1 million. No, I just kidding. Shannon asked how many she could ask. She'll ask a few, and then she can find you later.
The first one on the network changes, OHS used out of Regency's network for 2027, and I didn't see that highlighted in the slides.
So Shannon noted that Regions is not going to be partnered with OHSU in 2027, so they don't have Regions as a particular network. So I'm only talking about the actual network changes. This is a great reminder that you will always want to have your folks check to see if their providers and their hospitals are covered by the plans that they're looking at.
And then I also wanted to verify, I think I saw that it's a 12,000 out-of-pocket max for 2027, so is the new out-of-pocket maximum?
So the question was whether the new out-of-pocket maximum is 12,000. That is the that is the upper limit of the federal max. That is not the current max on any of the plans. The standard bronze plan, well, carriers can offer that on their non-standard plans. I always speak about the standard plans. The standard bronze plan is 10,200, and the standard silver plan is 10,600.
I also want to double check in the filings that were released for 2027. It seemed like all of the carriers dropped their traditional HSA plans, which usually had a 7,000 or 8,000 out-of-pocket max. So those clients might be going up to a 12,000 out-of-pocket max if they just go with the lowest bronze plan.
So I will note that I have not had a chance to look at all of the out-of-pocket maxes, but I did see that some carriers did discontinue their traditional high deductible health plans and others did not. So there should still be a range. And again, everything is a balance, right? If you are looking at a high out-of-pocket max but pre-deductible coverage where you're not going to pay that much for care, then it might be worth it. And that's why we have insurance agents who I love, because I really appreciate that you all understand these nuances and can talk about them with your folks.
And then the hearing aids are free on the standard plans. Where would we find information like that that's easily accessible to us?
Well, so Shannon asked about what I said about hearing aids being free on the standard bronze plan and where you could find information about that. You can find information about that on, right now, if you go to OregonHealthcare.gov, you can look at our window shopping tool, which has information about hearing aids. You can use our plan guide on our Explore Health site when that launches in October, and it will also have information about hearing aids. And then I do try to mention things like free hearing aids on the bronze plans at events like this when I have folks in the room, because those are just kind of weird little one-off things that happen sometimes.
Yeah, like the state legislative changes that impact just the standard plans, that's new to me. So is there some place in OregonHealthcare.gov that would give a list of those things?
So Shannon asked about state changes to the standard plans and if there is a centralized location where one could find information about that. So there is a site, the Division of Financial Regulation does include that information on their website, but Amy and I have been brainstorming different pieces of information that might be helpful to folks. So I'd be happy to add updates to the standard plans to our website so that folks can find those changes to mandates.
Just wanted to confirm on the crosswalk in the past, or that crosswalks, those folks have also been eligible for a special enrollment. That's going to be the same.
So Matt asked for folks who are being crosswalked to a new carrier if they would be eligible for a special enrollment period. In the past, healthcare.gov considers that a discontinuation of minimum essential coverage, and so that's why they do a special enrollment period. We are not sure yet if we will do a special enrollment period specifically for those folks. There's a lot of flexibility built into the system because it is a transition year, and so we may not need a special enrollment period because we may be able to use the just general flexibility. So we haven't quite figured out yet exactly what we will do, but we will have opportunities for those folks to come in the first part of the year and be like, I didn't know this was happening and I would like to choose something else.
One question from the chat.
We have actually two, but I'll start with the first one. Is healthcare.gov going away for small employers? What happens to the small employers that were eligible for shop tax credits through healthcare.gov?
Thank you. So is healthcare.gov going away for small employers? So we have actually always been a full state-based marketplace for SHOP. So folks have always enrolled directly with an insurance carrier and then submitted an application to us that said, I'm so-and-so, I have this many employees. Well, usually it's their agent submitting it. So-and-so have this many employees and enrolled in this plan, and then we say, yep, you qualify for SHOP. So that process itself will not change. We are going to be revising our SHOP page. We will have an actual plan display for SHOP this year, and then we're hoping to do like a smart sheet so that folks can just apply quickly and easily on the website rather than fill out a form and send that in to us.
Hi there, I was just wondering about the people who are crosswalked over. When will they be notified of their new plan, and will they have the opportunity to change it to a different option?
So the question is, when will folks who are crosswalked know about their new plan? So they will know about their new plan when they get a notice from Explore Health. So that won't be until October. We may do some outreach with their existing carriers to let them know. As Amy mentioned before, we're in a little bit of a kind of uncertain period where we're not allowed to actually do outreach to folks, and so we may leverage our other avenues that we have to get information out to folks. And then folks can choose a new plan at any point. As long as open enrollment is open, they can choose a new plan.
I just want to add that we're tentatively planning on sending the renewal notices around October 23rd-ish.
Does the state have any flexibility in granting an SEP for loss of provider? Because that might be something that's going to occur as part of this things.
So the question is, does the state have the ability to offer an SEP for loss of provider? And at this point, no, that is not a standard SEP. However, if we were to find that, let's say, an entire health system leaves the map, we would have the ability to offer an exceptional circumstances SEP. So we will be keeping an eye on folks to see how they're doing. And again, because this is a transition year, we'll have a lot of flexibility, and so hopefully we can use those built-in flexibilities to help folks make sure they can find a plan that covers their provider.
I have two questions. One is, to SEP, because we have two carriers leaving the market. Will you extend their SEP? Using based on Medicare, they sometimes have that extension beyond the January 15th. So that's the one question. Second question, will you have a list of type of visa that you call lawful and unlawful, so I can help, because I have lots of people on visas. And when these people, let's say, they become uninsured and they got pregnant, what do they do?
First off, come talk to me at break. I have many things I would love to share with you. So the first question was about the SEP for folks who are losing their carrier. So as I said, we are currently looking at whether an SEP is needed for those folks or whether we can use existing flexibility. We do anticipate those folks will be able to still choose a plan after January 15th if they find out that they don't like their crosswalk plan or they were unaware of it. So we will have some flexibility for those folks. We just aren't sure what that flexibility will be. The second question was about whether we have information about the eligible immigration statuses, and Amy said that yes, it is actually in your toolkit. And then the system itself will ask explicit questions so that it can make sure that folks are reporting their income, or excuse me, their immigration status correctly so that it can make that eligibility determination. And then lastly, the question about folks who are pregnant who become uninsured. So some folks will be eligible for other types of programs that we have, such as maybe like Healthier Oregon. There are also uncompensated care programs, and so there are options for folks out there. And I really encourage you to work with community partners who often know about those programs and can help folks find some other coverage options in those situations.
So Shannon's question when she started asking about some of the essential health benefits that are beyond the federal is maybe answers that you don't have yet, but with 2028 and the frail coming up, do we have any guidance on what's going to be happening in the state? Is there budgetary concerns on how we're going to continue to offer some of these enhanced benefits? Are they going to be removed from the plans? Any guidance on that? Because I don't want to start talking about something and then 1 year everything disappears and then have to unwind.
That's a great question. So the question is what happens in 2028 when benefits that are not considered part of the essential health benefits package are required to be defrayed by the state. And defrayed by the state means that the cost for those benefits has to be covered by the state rather than the enrollee or the insurance carrier. And I will just note that that falls under the Division of Financial Regulations purview, and they are the entity that would decide what is defrayed. Most of the things that are in our plans are actually part of the essential health benefits package. There's very few things that are not. So I don't anticipate we would see large changes. It would probably be small changes that either, the plans would adjust or the state would work out defrayal arrangements with the insurance carriers.
Are you going to bring on any new insurance companies in the coming years?
So the question is whether we plan to bring on new insurance companies in the coming years. So we do have Humana, who's joining us this year. We have an opportunity every 2 years for insurance carriers to apply through our request for applications process, where we accept any insurance carriers that can meet our requirements. At this point, I don't have plans to bring on new carriers. We've been very spoiled in Oregon to have had domestic carriers, and I find that the quality of the plans that they have offered is often, I think, surpasses what is offered by some of the larger national carriers. So we will be considering, we'll be looking at how enrollment goes this year and how folks are feeling about their plans. But at this time, I'm not actively recruiting new insurance carriers.
Question in the chat. If Providence and Pacific Source are no longer available for SHOP plans in 2027, are carriers other than Kaiser submitting plans for SHOP certification?
So the question is, with Providence and Pacific Source leaving, will Kaiser be our last remaining SHOP carrier? At this point, yes, but I will be asking the other two carriers, Moda and Regents, if they would like to offer SHOP plans. Moda has in the past, Regents never has. It's not really extra work for them to offer SHOP plans, so I'm hoping they'll say yes, but at this point, I cannot guarantee anything.
Last question. It seems like based on the networks that were shown outside of the Portland Tri-County area, there's not a carrier that will cover Portland Providence hospitals.
So the question is whether for folks who live outside the Portland area, if their network will cover Providence hospitals. At this point, I don't know. I have not been able to, the carriers file these massive files and I'm not a computer, so I can't process them. So I need to wait until it's actually loaded into our system so I can see. I know that currently some carriers cover Providence hospitals for their folks who live far away from the Portland area because they need that network adequacy. And so folks will have to use the provider search and the hospital search to see what facilities and providers are covered. And I'm hoping that you'll find that there is still an option for folks.
Okay. I wanted, with Regents, it seems like they'll still cover like Hood River, Providence, or some of the outliers, but it doesn't seem like anybody's going to be covering like Providence, St. Vincent, the large Providence hospitals in Portland. So my question was, like, you're going to have a lot of folks in Eastern Oregon, Central Southern Oregon, who use Portland Providence for specialty care that won't be able to have access. Are there any plans that the state would have to make the process consumers have to use for continuity of care to be easier and just a little bit more accessible for folks who are currently in the middle of critical care at those big Providence facilities in Portland?
So the question is for folks who live outside the Portland area who go to Providence facilities for specialty care, can we make the process easier for continuity of care? That is also a process that DFR does, and so we certainly can talk to them. I would also just recommend if you have clients who are using those services and facilities and providers to get as much in as they can before their plan ends this year. And then obviously let us know. We work closely with DFR and their advocates are really great. And I know that regions often will help do these kind of single case agreements and things like that. And so I'm hoping MODA will as well. It's going to be a rough time. Providence pulled out PEB, so there's a whole bunch of people, me included, who are trying to figure that out. So it's going to be rough, and just please, let us know what you're seeing and hearing so that we can try to help from our side as much as possible. Thank you all so much. Seriously, please let me know if you have more questions. I'm always happy to talk to folks, obviously, but just wanted to give a shout out. Really appreciate what you do. I'm always telling people to contact an agent or a community partner because this stuff is really complex, and so really appreciate you all for your time today. We appreciate you.
All right, thank you, Katie, for providing the updates. We know that it's going to be a challenging year, but hopefully we'll get through the challenges together and we'll support each other. And as Katie mentioned, we're all here to support you. So if you need any guidance or any extra support, just let us know. So our next section is our Partner Spotlight panel. We have someone joining remotely. I don't know if he's ready. Do we know if Nishoba... let's go ahead and take just a quick 5-minute break so we can get ready for the Partner Spotlight panel. And if I can have the 3 Partner Spotlight folks come up to the front and get ready. Okay, yeah, Wayne, yes, I will mark you down and I'll send it.
Better if I just stay at the podium.
Just a second, I'm sorry.
We're going to make Nishoba presenter, so we're good there.
What?
We're going to make Nishoba presenter.
Okay, I'm trying to figure out how I can fix this so that we don't have to...
Hi, I'm an agent, and I'm not sure if I filled out the form you keep referring to.
Okay.
I get emails from you sometimes, so it makes me think I did.
Okay,
but
I can check.
would you be so kind if
yes.
I could give you this information?
Perfect. Thank you so much.
Okay,
I will
and then
double
you
check
can
our list, and
reach
if I
out to
didn't,
me,
I
yeah.
will send it to you.
Thank you, Amy.
Hi, Amy.
Hi.
When you were talking about the form
Yes.
we have to fill out for you,
yes.
Would you please send me an email?
Yes.
I've already sent you an email now.
Okay.
Asking.
Perfect.
Yep.
Yep.
So,
I will get it.
Tina Manfa.
Perfect.
Nice
Yes,
to meet
thank
you.
Same question. Okay. We'll send you an email. Yes.
Let me see. Oh, up here. I'm sure you confirm.
Let's see if I can get this.
Yeah, I was reflecting, I remember my first Marketplace Summit, however, what, 12 years ago, or 10 years ago, not the first year, maybe it was covered work, maybe it was the very first one.
What is happening? No.
There's some people that still use it, and I'm like, oh my god.
My wife was working as a veteran enrollment.
Yeah, oh yeah, just like that.
2 weeks.
Yeah, and setting up people's emails, I gave us,
Okay, what is, I'm sorry.
This last year was not, and I felt, I like, I've had a lot of clients, but it's still.
I'm trying to see if I can get Neshoba to show. Yeah, I don't. Hopefully that works. Why is this not working?
Of course. No, my clients own it, right? They own it. It's still.
I'm sorry.
Right, and they're like, wow. So no, it's, you know, and that's like, I don't for this, or I'm sure you let me just ensure that's it. So there's no, yeah, that and I just emotion, like I'm working hard on my sleeve, so I felt it. Right?
Okay. Can you see if you can see this on your screen?
Can't use this on. Oh, did you just do it? Because I saw it.
What were you going to say?
I was going to say, I made Neshoba a presenter. I also talked to Claire and the people getting notified if they're reassigned agent thing. It's a configuration we can turn on. Comments. It's a configuration we can turn on. Whether the consumer has to approve getting shifted around within an agency. Yeah. So Claire is putting configurations to see what we have and we can discuss.
Michael, I'm going to introduce you, okay?
Yeah, so how will I see the initial?
So you can sit here and just talk, and I'm going to just turn this off, and hopefully
It'll be able to shine you.
That's what I'm hoping.
Okay.
You got your stuff?
Yep.
I can do this mic over there. I'll put this mic.
Oh, that works.
Okay, are we ready? We're going to go ahead and get started. I know that was a quick break, but we're going to do lunch soon. I promise. Food's on its way. Okay. Well, everyone's finding their seat. Next up, I'm going to welcome Michael Wallace. He is our agent and employer liaison. He's going to facilitate our partner spotlight panel. For everyone who's joining virtually, we would love for you to participate as well. Please share in the chat what community or population you primarily serve. Also, I just want to mention Neshoba is one of our panelists, and he is joining remotely. So unfortunately, we can't see him, but hopefully we will be able to hear him. So we're going to try this out. Sorry, guys, for the technical glitches. So Michael, I hand it off to you.
Good.
Thank you, Amy. All right, and thank you to our participants for joining us for our partner spotlight panel today. I definitely appreciate it, and we're excited to get started. So today we're excited to highlight the credible agencies and organizations participating with us as official partners with the marketplace, and recognize the impact that they're making through the collaboration, outreach, and shared commitment to our mission. But before we jump into our panel, I'd like to introduce the newer partners to our official partner programs, which include our partner agent grant program and our community partner grant program. So these are two opportunities designed to strengthen relationships
expand community impact, and create meaningful connections built on trust with the people and organizations we serve. We're grateful to have a few of our official partners with us today. So I'd like to first introduce Alex Juminka Perez, an assistant with Arcoides Cultural, and they're located in Newport. Matthew Woodbridge, owner and insurance agent at Matthew Woodbridge Insurance, with his office in Salem and Woodburn as well during open enrollment. Nishoba Temperley, as Amy mentioned, who will be joining us virtually. And he's the manager of benefits navigation at Cascade Aids Project, located in Portland. And Shannon Saldivar, owner of insurance at Shannon Saldivar Insurance, with offices in Hood River and the Dallas. So Pam, let's go ahead and get started. Matthew, just since you're directly to my left, I'm going to start with you on the first one. Please tell us about the specific community or communities you serve.
I knew there was a reason everybody sat down on that. I would go first. So I'm a bilingual insurance agent, Spanish and English. I work primarily in Spanish-speaking communities throughout the valley and around the state, and then also up into Southwest Washington. That has led to connections with some of the other immigrant communities too, so Pacific Islander, the Russian community, the Vietnamese community, and then here over the last few years, strong connections into the Indian community. So really, immigrant communities have a fairly large number of English-speaking clients as well, but really the immigrant communities and Spanish-speaking primarily.
Shannon, if you'd mind going next, that'd be great.
Yeah, hi, I'm in the Columbia River Gorge, so the Dalles and Columbia River, and my communities I serve is really everybody but rural Oregonians is who we serve. I'm Spanish speaking, not bilingual, but I have two agents at my office that are bilingual and bicultural. So, yeah, and everybody who needs health insurance, and being in a rural community, we're one of the only agencies, I think, in our area, so anybody who needs help navigating the system.
Good morning, buenos dias. My name is Alex Juminka. I'm the director of Arcoides Cultural. We're a nonprofit organization located in Lincoln County, in Newport, and we serve the entire county. And we serve primarily the Latino and indigenous Mesoamerican Guatemalan communities that are located in our county. Also the LGBTQ+, and also our rural communities. And our focus is on providing culturally responsive support and also the language access. We have our staff speaks quite different languages from different regions, from indigenous Mayan languages, from Hmong and Nahuatl, Spanish, and also we support the English-speaking community as well.
And Nishoba, if you would be okay going next, that would be great.
Thanks, Michael, and appreciate everybody with a connection via remote, and hopefully communities can hear me speak. Thank you for that. My name is Nishoba Temperley with Cascade Aids Project. Use he, him, his pronouns. We're primarily based out of our Portland-based office. The communities we primarily serve are the LGBTQ plus communities, HIV positive communities. We also work with a wide range of self-employed folks. We assist obviously in marketplace and are state-based and private plan enrollments, but also specialize in Medicaid. And we work with pretty large communities of folks experiencing houselessness, have a wide array of outreach and community partner relationships. We have English and Spanish speaking navigators and assisters on staff. And yeah, thanks, and I appreciate the time be able to speak on behalf of our programming. Thank you, Michael.
Thank you so much, Nishoba. I appreciate it.
I'm not sure if you, we may have lost audio in the virtual space. I don't know if you were calling on me to facilitate and kind of talk about the next session about building trust, Michael.
Yes, that'd be great.
Sorry about that. Yeah, seems like we lost most of our audio. Very quiet if folks can just maybe speak really a little bit lively into mics. But yes, building trust is an integral, very important part of our enrollment work. A lot of the strategies we've used are really important that we found successful are really, being representative of the communities we serve. Is so important to build that initial and long-lasting trust. To work with community partners that have already had and built on and maintained community partnerships and have those close working relationships, providing outreach and in those spaces, in those trusted areas, rather than maybe launch and host independent sessions, creating those intimate referrals through those community partners and agencies, but also, just those other human elements to be able to build trust, spend time with individuals, create really customized experiences for individuals and their needs, be able to do research and follow up, and to remember folks. A lot of folks I understand, are extremely busy, but, we developed a system to a follow-up reminder system to all folks that we've helped navigate, to reach out to folks that we've previously assisted in prior years, and to build alliance and allegiance in groups and sessions like these, to just understand what what options are out there, to be able to find and supply choices and resources for folks, and to tailor information resources ultra specifically to those communities, I think is really important and integral. That we understand the specific issues, societal and healthcare barriers that specific individuals and groups experience, and to be able to surmount or at least understand some of those. So thanks, Michael. I'll pass it on to the next panelist. Thank you.
So much. I'm sure that this big spaces. Responsive systems.
Some of the same things that have been shared so far, especially with my
We're available year-round.
Sorry. Enough to hear myself, let alone that comes out of it. My agency's around available year two, so you can visit any time of the year.
Yeah, and taking time. My 13-year-old daughter would be so embarrassed. Testing. 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 Health insurance. I think that was pretty much what I was going to say. I think I wrapped up. So yeah, working with other local nonprofits in the community, having those just tight networks, we're all working towards the same goal and we're all in this together. I think partnering with Oregon Health Insurance Marketplace, connections to my carriers, like just knowing the landscape and being available to help consumers regardless of what they need and being willing to take time and do the work. Oh, that's right. Like it is hard work, but that's how you build trust, is being there, being available, answering the questions, getting the answer if you don't have it. And there's no silly question. Consumers often start with, like, I'm sure this is a dumb question. Like, no, there are no silly questions. And we know it because we've been doing it. But it's, yeah, putting the time in and really genuinely enjoying what you do too, I would say.
I'll echo here. So likewise, I think just gonna rephrase what everybody is doing. You're doing a great job. As a nonprofit organization, our role it's to do everything, but in all these different languages, try to support our community members to access to the information in their own language. That's a challenge, but fortunately, throughout our years of experience, we have been able to hire staff that comes from our own communities that have that lived experience and understand their own smaller community, and especially indigenous communities that are familiar with systems, the healthcare system in this country. So it's a challenge, I'll say, but it's also a blessing to have the opportunity to support our communities. And as also a cultural organization, we love to host events and we love to host celebrations. And through these events and gatherings, that we take the opportunities to share what's available, what resources are available, and also building those partnerships in our own community helps us spread the word, help us to keep gaining that trust in the community. So I'll say that, and also, we always try to be aware that everybody has different needs and times during the day. So we try to be flexible about those, serve the communities when they're able to come to our events or come to our office. Just make sure we have someone there supporting in their, own schedules sometimes.
Thank you, Alex. That was great. So the next question we're going to approach is, what has been the biggest benefit of being a marketplace official partner? And we'll start with Nishoba.
Hey, everybody. Seems like we've got the audio back. Sorry for the tech issues. We appreciate all the flexibility.
I apologize, Nishoba. We
Yeah,
unfortunately
it's okay.
cannot hear you.
Oh, cannot. Not sure if any of the online or the virtual attendees can also hear me. We can kind of keep speaking, at least to present to them in the interim.
Go ahead. Go ahead. All right, I'm going to go ahead and pass the mic over to Matthew.
So biggest benefit of the program, so this is my 9th year, I think 9th, it might be 10th, I'm not sure, and as a partner agent in the program. And I think the biggest benefit I've seen is not, I don't think it's a benefit specific to me, but just the community that's been built through this program. When the Affordable Care Act started and we started doing these things, even in the first few years of the partner agent program, the community partner, assister, and agent communities were completely separate. And there was a lot of mistrust, misplaced mistrust, uncertainty, hesitation about interactions between the two, because there was a kind of a mindset that they were two different worlds and they competing for the consumers that are out there in Oregon that needed coverage. And through the Marketplace Partner Program, we've brought those two communities together and really focused on the shared goal of covering Oregonians and keeping them covered, managing those transitions between the different methods of coverage and working in partnership and concert with each other to achieve those goals. So that I think is the biggest benefit I've seen from the program, is just the entire ethos that surrounds covering Oregonians through this program and with all of the work that we all do.
Yeah, I would agree with that too. And I'll add in, I love all the marketing material, and I love it's just ready to go. I don't have to do anything. I have it in different formats. It's in different languages, and that's been just wonderful and made it really easy to use. I feel like this program has allowed me to get on the front end of the Affordable Care Act too. I remember the first few years, you're like, I don't even know what's going on, and it was really overwhelming, and there was nobody to really go to. And so I love having a team, it feels like. Again, I'm just a small agency in the Gorge, but I feel like I have a team behind me, and that feels great. And also helps my clients, is there's always somebody I can call to get an answer. I don't always get answers from healthcare.gov, so it's nice to have local folks to get answers. And I feel like with the rollout of our state-based marketplace, that's going to be even better. So I'm really excited for how much more strong Oregon's going to be because of the state-based marketplace and the additional support we're going to be able to have.
This is our first year that we're partnering and have received the funding to support this this program. And I think the greatest benefit has been the materials that you have ready, just copy paste, and also sometimes the flexibility of create our own materials for our reach. And also something that I want to highlight is recently we have been able to meet with our friends Federico and Inandina to have our conversations in our main language, Spanish. So that's greatly benefits me to understand more. I've been an OHP assistant for many years, and we always had that support from our team. So I appreciate that you have been able to providing that opportunity for us. So thank you.
Thank you, panel. All right, we're going to jump to the last question that we're going to address, and that's, how has being an official partner impacted your ability to help the communities you serve? just for the ease of passing the mic, I'm going to start with Matthew again.
A likely story. So I think the biggest way that the partner program has impacted is it's allowed me to expand my reach. It's allowed me to reach a lot more, like a larger number of consumers in a larger number of ways. It's in a way eased the workload because I have all of these resources at my disposal through the materials we can order, the ready-made toolkit that's available for us. And, even with the transition from Oregon Health Plan to Marketplace plans and Marketplace plans to Oregon Health Plans, the ability to reach out. I mean, I do Oregon Health Plan as well, but the ability to reach out to community partners that I know and trust in the community and know that when I hand that consumer off, they're going to be taken care of properly. It's just a peace of mind piece, which I don't end up thinking about that for the next 4 days and wanting to follow up. I know they're done, they're taken care of, and I can just move on to the next case. So that's really it for me.
I would say too, the support that I get on the back end, as well as the funding that we get, allows me to have more staff than what I might need if selling was my primary focus. So it allows me to shift to really just like helping folks, A lot of times there's folks who come who are on Oregon Health Plan, or it just changes where you're not selling them anything. And I'm a small business, so my reserves aren't very big. Small local business, so being part of the program has really allowed me to have the support year-round, expand, and have also consistent staff in my agency too, which has helped the community. They get to know folks and they want to continue to work with those same people. So it's been really, really tremendous to be there and be there year-round for folks.
As an official partner, the impact that we have been able to experience this year has been tremendous. I think gave us the opportunity to hire someone that supports the community directly with this funding. So I know that a lot of changes have been happening the last year, especially have impacted our communities, especially the immigrant community, and there's a lot of distrust in the government right now. So I feel like for us having that opportunity to bring the message directly in a way that we can start building that trust again, it's so important now. And I think being an official partner, that makes us an official organization to share that information. And I know that a lot of changes are happening in our communities, especially the immigrant communities that are able to now have an immigration status that allows them to become more financially stable. And with that financial stability also comes, the benefits, and there's the other options that they can be able to receive. So through this partnership, I feel like it's been challenging the first year for me, especially for us, learning everything. It's very complicated, but I think we're moving forward to a new year, and I'm very much looking forward to continue that partnership.
Well, I want to just thank the panel one more time. We really appreciate all these great partners taking part in this with us today. And Shobha, my sincere apologies for the technical difficulties, but again, much appreciation for your participation as well. And at this point, I think we're just about ready to go ahead with lunch. And so I will go ahead and put the mic down for now, and assuming we are set for lunch, we will go that way. Few more minutes on lunch, so we're just about there.
Yep. Hello, everybody. The food's ready, so feel free to go back and grab whatever you want.